The Pharmaceutical Society of Nigeria, PSN Oyo State Branch, presents PSN Oyo State
Scientific Week and Pharmacy House launching.
Theme: Building a Sustainable Future for Pharmacy, with special focus on inter- and intra-professional collaborations, patient-centered care, artificial intelligence, and telepharmacy. Facilitator, Pharmacist Olumide Akintayo, FPSN, former President, Pharmaceutical Society of Nigeria, PSN. Guest speaker, Professor Chinedum Babalola, former Vice Chancellor, Chrisland University, Abeokuta. Panelists, Pharmacist Dr. Omobolanle Adekoya, Deputy Director, Pharmaceutical Services, University College Hospital, Ibadan. Professor Rasaq Adisa, Department of Clinical Pharmacy, University of Ibadan. Pharmacist Wale Oladigbolu, FPSN, former National Chairman, Association of Community Pharmacists of Nigeria, ACPN. Chief Host, Pharmacist Ibrahim Tanko Ayuba, FPSN. President, Pharmaceutical Society of Nigeria, PSN. Host, Pharmacist Colonel Victor Shegun Ajanoku, retired, FPSN. Chairman, PSN Oyo State Branch. Date: Tuesday 8th July to Thursday 10th July 2025. Venue: MAV 21 Event Center, Ibadan. Time: 12 noon. Program of events: Tuesday 8th July, visit to the Olubadan's Palace, Okearemo, Ibadan, and community health outreach. Wednesday 9th July, conference opening ceremony and scientific sessions at MAV 21 Event Center, Ibadan. Thursday 10th July, grand launch of Pharmacy House. Time: 12 noon. This hybrid event will be streamed live on the PharmStream TV YouTube channel. Subscribe today for instant notifications when the event goes live. Announcer, Pharmacist Ramon Oyewole, MD, Good Old Pharmacy, Chairman, Planning Committee.
All right. Hello. Okay. Hello. All right. Good afternoon, ladies and gentlemen. Good afternoon, pharmacists in the building. Good afternoon, friends of the pharmacy profession. We welcome you, and now we are going to start the event officially. So, ladies and gentlemen, we'd like every one of us to be seated at this moment. Please, for those of us who are at the exhibition stand, we'd like you to be seated at this moment. And also, we want to believe that everyone seated in this hall has registered. Please, if you are not registered, it's important you do so that we can keep the record that you are a part of this event. And I especially welcome you on behalf of the Executive Council of PSN Oyo State to the PSN Oyo State Scientific Week 2025. It's another moment that we're going to be having discussions, and also don't forget tomorrow we're going to be having launching of our edifice, the 550 million naira Pharmacy House Secretariat Complex, the first of its kind in Nigeria. Please, pharmacists in the building, give yourself a round of applause if you're happy to be here. The theme of this year's celebration is building a sustainable future for pharmacy practice. So, ladies and gentlemen, I'm not going to be doing this alone today. I have a pharmacist. I'm just a friend of the pharmaceutical profession. I'm not a pharmacist, but we have a pharmacist here who is also going to be a co-anchor of this event. And it's another person, pharmacist Marzouk Ahmed. Please, a round of applause for us. Now, well, we are going to start now. Okay, and also, we have a woman of valor who is also a pharmacist. We are going to be doing this together this wonderful afternoon. And she is pharmacist, Dr. Mrs. Aderunke Anifowoshe, DSA, MAW. Please, a round of applause for her. Thank you very much, Doctor.
Yeah, before we proceed, all fellows in the house, please come to the front. All fellows of the Pharmaceutical Society of Nigeria, please come to the front. And all MAW, please come to the front.
We've reserved the front seat for the fellows. You are special people in this profession, and we also have to recognize you. Please, you have to sit at the front, and also behind them is the MAW. Please sit appropriately so that we can recognize you accordingly. Now, please, we are going to kickstart the program with the national anthem, which will be followed by the Oyo State anthem. Ajishebi Oyo Lari, Oyo Shebi Babeniko. And also, I want to use this medium to commiserate for the people of Ibadan, for the demise of our monarch, the Olubadan, who departed this world a few days ago. May his soul rest in peace. Now, I want to believe the media team is ready to take the national anthem. Please, every one of us, I crave your indulgence to please be on our feet to take the national anthem to respect our dear nation.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace all battle honored, and this we count as gain. To hand unto our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Oyo State anthem.
Aṣíwájú ni wá, aṣíwájú ni wá, aṣíwájú ni wá, aṣíwájú ni wá. Ipò aṣíwájú l'Ẹlẹ́dùmarè fún wa nípínlẹ̀ Ọ̀yọ́. Ìpínlẹ̀ Ọ̀yọ́ ẹ jẹ́ ká ṣe gírí, ọmọ Ọ̀yọ́ ká tẹpá wa mọ́ṣẹ́, ká bára wa sọ̀rọ̀, ká sòdodo, ká ṣohun tó tọ́ tó dára nígbà gbogbo, níbi gbogbo fún ìpínlẹ̀ Ọ̀yọ́. Onírẹ̀yìn o, lójú mi, onírẹ̀yìn.
Thank you. We have our seat. We pharmacists, we are indeed Ashiwaju in the healthcare sector. If you are an Ashiwaju, please a round of applause for yourself. Long live Nigeria. Long live PSN.
Yeah, before we continue with our program, permit me to acknowledge the presence of some of our eminent guests. Dr. Ganiyu Abidin, the Director of Pharmaceutical Services, Oyo State Hospital Management Board. You're welcome, sir.
Please a round.
Pharmacist Dr. Adeyinka Ishola, the Director and Head of Department Pharmaceutical Services, University College Hospital. You're welcome, sir. Professor Titilayo Fakeye, the Dean, Faculty of Pharmacy, University of Ibadan. You're welcome, ma. Pharmacist Colonel Victor Shegun Ajanoku, retired, the Chairman, Pharmaceutical Society of Nigeria, Oyo State. Also, the presence of Professor Rasaq Adisa, a professor of clinical pharmacy from the University of Ibadan. Your presence is acknowledged, sir. Pharmacist Olumide Akintayo, FPSN, the former PSN National President. You are welcome, sir. Pharmacist Oyawole A.B., FPSN, former PSN Chairman, Lagos State. You are welcome, sir. Pharmacist Dolagade Iyola, FPSN, former PSN Chairman, Lagos State. Pharmacist Lanre Familusi, FPSN, the former Secretary, Board of Fellow, Pharmaceutical Society of Nigeria, and also the former PSN Chairman, Lagos State. You're welcome.
You're welcome.
Pharmacist Gafar Madein, FPSN, the National Secretary, Pharmaceutical Society of Nigeria, representing the Pharmaceutical Society of Nigeria National President. You are welcome, sir. Pharmacist Adenike Ogunlola, the Southwest Zonal Coordinator, Pharmacy Council of Nigeria. You are welcome, ma. Also, the pharmacist Oluyemisi Oyewo, the Provost, Oyo State College of Health and Technology, LALA. You are welcome, ma.
Thank you. We appreciate your presence. And also, we'd like to appreciate members of thought groups under PSN, Oyo State, and PSN Nigeria at large. First on the list is Association of Hospital and Administration Pharmacists of Nigeria. Please, a round of applause for yourself. Also, Association of Community Pharmacists of Nigeria, ACPN. A round of applause for them. I also want to recognize the Association of Industrial Pharmacists of Nigeria, NIPE. Please, a round of applause for them. Also, Nigeria Association of Pharmacists in Academia, because without them, we won't be here today. They are the bedrock of pharmacy profession. Thank you. Also, the young shall grow, the tomorrow of the profession, the Young Pharmacist Group. Please, a round of applause for yourself. Thank you. And also, I want to specially recognize members of Association of Lady Pharmacists, APS. All right. Thank you, ladies and gentlemen. And now that we've taken the anthems, the next in line of our programs today is a welcome address by the main organizing committee chairman. Please, with an applause, let's welcome Pharmacist Rahman Oyewole for the welcome address.
Pharmacist Oyawole AB is the chairman of the occasion and is duly acknowledged and welcome.
Thank you, you're welcome. Please, let's welcome Pharmacist Rahman Oyewole for the welcome address.
Good afternoon, my dear colleagues, our fellows in the house, our senior-most colleagues, headers of the society, the dignitaries sitting down, our guests, our colleagues, all other protocols duly observed. Distinguished colleagues, esteemed guests, our guest speaker, members of the Pharmaceutical Society of Nigeria, PSN Oyo State Chapter, ladies and gentlemen, it is both an honor and privilege to welcome you all to the 2025 Pharmacy Week celebration. Standing before you today as chairman of this year's planning committee fills me with immense pride and gratitude. On behalf of the entire committee, I extend a warm, heartfelt welcome to every one of you who has made the time to be part of this important week reflection, learning, collaboration, and professional development. Our theme this year, building a sustainable future for pharmacy practice. How best it can be achieved through one, intra and inter-professional collaborations, patient-centered care, and artificial intelligence and telepharmacy. It's both timely and forward-thinking. It captures our collective aspiration to shape a resilient and innovative pharmacy profession that not only adapts to change but leads it, especially in the face of rapidly evolving healthcare challenges we find ourselves here in. Pharmacy Week is far more than a commemoration. It is called to action. It provides a platform for us all to reflect deeply on our roles and contributions as pharmacists, spanning patient care, pharmaceutical innovation, regulation, and public health advocacy. More importantly, it offers us the opportunity to engage in rich dialogue, foster partnerships, and reimagine the future of our profession. As is customary, we are privileged to have our keynote speaker, a distinguished academic, a brilliant pharmacist, and a erudite thought leader whose insights will do great justice to the theme of this year's celebration. This year's events have been carefully curated to combine learning, community impact, and professional network. This week-long program from 8 to 10 of July 2025 kicked off with a medical outreach at Olumide Palace, followed by a press briefing. Today, Wednesday, marks our grand opening ceremony. Activities will continue. We culminate on Thursday with a landmark event, the launching of the Pharmacy House Secretariat Complex, a visionary project aimed at raising the targeted 550 million naira. I am confident that with the passion, generosity, and the unity of our colleagues, friends, partners here today, the goal is well within the reach. I'm confident. At this point, permit me to express my heartfelt appreciation to our numerous supporters, the donors and well-wishers. Your contributions, both in cash and in kind, have made this event possible. I also want to extend a special thanks to you, to the dedicated members of this planning committee. Your tireless efforts, creativity, and teamwork have brought this vision to life and reality. To the Oyo State Chairman of PSN Pharm Colonel Filter Ajanaku, retired, FPSN. Thank you for entrusting me with the leadership of this year's committee. Your support and guidance throughout the process have been so invaluable. To the expected elders of our profession, thank you for your mentorship and steadfast encouragement. Your wisdom continues to guide us always. We shall be calling upon you all the time. We also extend our sincere appreciation to Executive Governor of Oyo State, His Excellency Engineer Abeokuta, our royal father of the day, Ọba Akinloye, Olalere, Owolabi, Olakuleyin. On this point, by the time I was writing this particular, I've sent it. I didn't even think that Kabechi would not be alive that time. Very, very unfortunate. I want to say, please, our headers in the house, another member, can we rise up for 1 minute silence for the departed Olumide of Ibadan? Please. May his soul rest in perfect peace. Thank you. Let's sit down, sirs. Thank you. The chairman of education, Pharm, Anthony Oyawole, FPSN, the honorable commissioner for health, our guest speaker, and our special guest. Thank you for gracing us with your presence and support. As we look ahead to the rest of this exciting week, I urge everyone to take full advantage of the knowledge sharing, networking opportunities, and vibrant discussion that lie ahead. Let us continue to amplify the relevance of pharmacy in our healthcare system and work together to build a future that is innovative, inclusive, and impactful. Thank you once again for being here, and welcome to 2025 Pharmacy Week. Thank you very much. Thank you. Thank you.
Thank you very much, sir. Thank you, sir, for the welcoming address.
All right. Okay. Thank you. Please, I think the chairman deserves another round of applause. That was a wonderful speech. And now we're made to understand that we have some important guests and dignitaries in our midst. I would like to recognize them now before we move to the next program.
Yeah, permit me to welcome pharmacist Abiodun Ajibade, FPSN, on the podium to acknowledge the presence of our important guest.
Please, a round of applause for him as he comes to the stage.
Well, good afternoon, ladies and gentlemen. At this point, we want to just further recognize many of our people that are seated here this afternoon. And in a little way, are we saying everybody is not important? We recognize everyone that are in this room at this point. And at first, let me quickly recognize a few more people here. Pharmacist Mokwillola Adetoru is a Merit Award winner and former permanent secretary, and the first pharmacist permanent secretary in Oyo State that we ever had. You are most welcome, man. Sitting very close to her is our national deputy chairman, APS. That is pharmacist Bola Ajao. You are most welcome. In this room this afternoon, there are a couple of people that are here seated who have worked for pharmacy profession in Oyo State. And their products are what we are celebrating today. Let me quickly recognize our daddy, pharmacist Ikuola Ogunye, FPSN, a former PSN chairman of Oyo State. You are most welcome, sir. Also, we have in the room one of our very, very active elder that is refusing to grow very old. And that is our very good brother and Egbon, pharmacist Olalekan Proctor Fashesi, FPSN, a former PSN chairman in Oyo State. You are most welcome. Let me also recognize Dr. Adekoya, though he's been recognized as the Director of Pharmaceutical Services and HOD, Pharmacy Department, UCH, but also is a former PSN chairman. You are welcome, sir. In the room, we also have one of our very young PSN chairman that was just the immediate past. Pharmacists Adekoya Ogutoye, FPSN, you are welcome. Let me also recognize former ACPN chairman in the room, Pharmacist Olufemi Ajao, you are most welcome. Also, let me also recognize Pharmacist Abiodun Badamosi, former ACPN chairman. You are most welcome. And while the planning committee chairman was giving his speech, the government delegates walked in. And at this junction, we'd like to recognize the officials of Oyo State government in this meeting this afternoon, ably led by the Honorable Commissioner for Health, Dr. Oluwaserimi Ajetumobi. You are most welcome. Sitting very close to her is our very good friend and the Permanent Secretary, Ministry of Health, Dr. Kehinde Ayide. You are most welcome, sir. I also have here this afternoon the Director, Health Planning and Statistics, Dr. Adekunle Aremu. You are most welcome. We also have the Director of Nursing Services in the Ministry of Health, Oyo State, Mrs. Adeoye Beatrice. You are most welcome, sir. Ma'am. And our very own, in the government space, the Director of Pharmaceutical Services, Ministry of Health, Pharmacist Adewale Moses. You are most welcome. Well, while we have taken this, I believe as more people are joining us, we'll be recognizing them. And just like I said earlier, everyone here is well recognized and very important. We welcome you. Also have in this meeting this morning, the NSDC Commandant, that is Nigeria Civil Defense Corps, Augustine Pandomo, representing ACC Adeoye Abiodun. You are most welcome, sir. So while many more people are joining us, before I leave this podium, let me recognize one important person that just walked in, Dr. Kayode Olunuga, FPSN, former PSN chairman. You are most welcome, sir. So as more people are joining us, we'll be recognizing them, and I believe strongly we are here for a very wonderful time. Okay. I'm just informed now that the keynote address speaker, she's here in our midst. And she's no other person than the first female vice chancellor of a university, a pharmacist, Professor Chinedum, Babalola, FPSN. You are most welcome, ma'am. Also, we are talking about collaborative health in healthcare. And it will be out of place if you cannot demonstrate it. And that is why this morning in this gathering, we have the representative of NMA chairman here. And that is Dr. Fakunle Olawi. That is NMA vice chairman too. You are most welcome. Where are you? Can we just see you? Let's see you. Oh, you are most welcome, man. So, while more people are coming, we'll be recognizing them. And I believe we're here for a wonderful time. Let's put our hands together again to celebrate ourselves. Thank you very much.
Please, a round of applause for Pharmacist Abiodun Ajibade for the wonderful recognitions of our dignitaries. And now we are moving to the next program, and that is welcome address by the PSN Oyo State Chairman, the father of PSN, the father of pharmacists in Oyo State, the man with two caps. He's a pharmacist and a retired colonel. Please, a round of applause for pharmacist Colonel Victor Shegun Ajanaku, retired, FPSN. You're welcome, sir.
Thank you, the MC. In as much as protocol has been established, I will still like to thank, or I would still like to recognize some people here. I would like to recognize the presence of Pharmacist Anthony Oyawole, who is the chairman of this occasion. Thank you very much, sir, for leaving, everything and traveling all the way from Lagos to this place to share this occasion. Thank you very much, sir. I would also like to recognize the presence of Pharmacist Olumide Akintayo. Thank you for coming, sir. And everyone that has been duly recognized has stand on the existing protocol. And I say you are all welcome to this annual scientific conference. Thank you very much. My address goes, the last time the Pharmaceutical Society of Nigeria, Oyo State Branch, had a scientific week was in 2021. That's about 4 years ago. 4 years is a long time in the annals of a dynamic profession such as ours. There are a lot of emerging factors in which any profession, worth its salt, must not overlook. Hence, we took a diagnostic look at pharmacy practice of our dreams in the front burner, and that's why the planning committee came up with this beautiful theme of building sustainable furniture future for pharmacy practice, how best it can be achieved. And it was hinged on a tripod. Intra and inter-professional collaborations, patient-centered care, artificial intelligence, and telepharmacy. This is in no doubt a wide topic, however. We have amongst us today brilliant minds, government officials, and equally intelligent policymakers who will help to shine more light to this theme and channel a way forward for us in order that our profession can meet the needs of the future. Pharmacy is in no doubt an endangered species in the health sector, especially in our country, Nigeria. Hence, the need for us to sit down today and brainstorm on our profession and see how we can continue to reinvent, innovate, and continually be relevant in the emerging world order. From training to research and service, we are entering a new dawn in our practice. New skills and knowledge have emerged. Therefore, we must find ways to upskill as pharmacists if we must remain relevant in the scheme of things. I therefore urge my colleagues not to relent in their efforts to seek knowledge in order to be able to sustain this noble profession. I salute our keynote address speaker, an erudite scholar, Professor Babalola, who agreed to speak to us on this topic, as well as other brilliant minds who will be here to dissect this theme as panelists. On this great occasion, on behalf of the President of the Pharmaceutical Society of Nigeria, Pharmacists Ayuba, Tanko, Ibrahim, FPSN, Miad, MBA, the Council of PSN, and the entire membership of PSN in Oyo State, it is with pleasure and gratitude to God that I welcome you to the 2025 Scientific Week and launching of 550 million of Oyo PSN Pharmacy House building. Please sit back and enjoy the occasion as they unfold. Thank you and God bless. Long live pharmacy profession, long live PSN, and long live Federal Republic of Nigeria. Thank you.
Thank you very much. That was a wonderful speech and a wonderful address made by the chairman, PSN Oyo. Our time is fast spent and we have limited time to spend here because we would not like to waste any of our time. So now we are moving to the next item, and that is goodwill messages from technical and interest groups. But please, representatives of this group, we only have 2 to 3 minutes for our goodwill messages. Please, because of our time, we have quite a number of events to hold here today. Please, I crave your indulgence. I plead with you. I know you have a lot to say. Within 2 to 3 minutes, we'd like you to give your goodwill message. And now the first interest group I'll be inviting to the podium is the Association of Hospital and Administrative Pharmacists of Nigeria, ACPN. Please, I would like the representative to mount the podium at this moment for their goodwill messages. Please, a round of applause for them.
The Honorable Commissioner for Health, Oyo State, and all dignitaries present. On behalf of the Association of Hospital and Administrative Pharmacists in Oyo State, I want to rejoice and celebrate with PSN Oyo State on the celebration of this scientific week and luncheon. I want to thank everyone that is here to celebrate with them, and I want to wish them success in all their endeavors. Thank you.
Please, a round of applause for her. When you see administrators, you know. And we pharmacists, we dish out drugs in doses, right? And I'm dishing out time dosage for you two today. So please stick to the dosage, the 2-minute dosage I'm giving to you. Now, please, a round of applause for the representative of the Association of Community Pharmacists of Nigeria, ACPN, for their goodwill message. Please, a round of applause for them.
Good afternoon. The Honorable Commissioner of Health, all distinguished guests, colleagues, pharmacists, it's with great pleasure and profound honor I extend my heartfelt goodwill message to the leadership and entire membership of the PSN on this scientific week titled Building a Sustainable Future for Pharmacy Practice. This gathering is not merely a routine, but a significant platform for pharmacists to come together to share knowledge, deepen professional bounds, and advance the frontiers of pharmaceutical practice in our dear state and beyond. I once again congratulate all of us and wish us a fruitful deliberation and week. Thank you very much.
A resounding applause for pharmacist Bayo Gbadamosi. That's the chairman of ACPN Oyo State. Thank you. Now to Nigeria Association of Pharmacists in Academia, the trainers of pharmacists in Nigeria. Please, a round of applause for them. Some of you are still going for your postgraduate programs. Please, a round of applause for them. Their representative, please. The Nigeria Association of Pharmacists in Academia. You're welcome.
afternoon, colleagues. I want to appreciate the Commissioner of Health, here present physically, and every other special guest, all the way from Lagos, my people, Pharm Wale, Pharm Olumide, Akintayo, and you are all recognized. On behalf of National Association of Pharmacists in Academia, want to rejoice with the PSN Oyo State for this August meeting, this happening in July here. We celebrate with you as academia, and we know that greater heights, better programs, and more impact in Oyo State through this program. In Jesus' name, thank you.
Thank you, Dr. Kemi Charles. Okay. Thank you now to the producers of our medications, the producers of our drugs, the Association of Industrial Pharmacists of Nigeria, the money spinners. Because someone told me that they are the big bag, money bag of pharmacy profession. I don't know if I'm right. Please, a round of applause for them, because they are going to be bringing loads of money tomorrow for our launching. A round of applause for the representative of the Association of Industrial Pharmacists of Nigeria for their goodwill message. Thank you. All right. I think the members of the association are nominating the PSN chairman of Oyo State to represent them here. Please, a round of applause for PSN chairman as they come to give the goodwill message on behalf of Naib. Abeokuta from chairman.
Good afternoon, everyone. Well, I'm not supposed to be standing here talking on behalf of industrial pharmacists. I expect a representative from them to be here. In as much as they are not here, I will try to represent them well. Well, on behalf of Association of Industrial Pharmacists, in which I'm proudly one of them, I am congratulating myself. I'm congratulating myself for at least organizing, this wonderful scientific week. And I want to say that I am with me. I am with me. And as such, of course, I wouldn't, who will not praise himself? So I'm praising myself as a member of Association of Industrial Pharmacists, as well as a member of Pharmaceutical Society of Nigeria, Oyo State Branch. So I wish, we pray for a good deliberation, and we wish you success in this endeavor. Thank you very much.
Thank you. When a man is representing a team and he also have to congratulate himself. Thank you very much, the chairman, for that goodwill message. Now we are going to have the goodwill message of the future of pharmacy profession in Nigeria. I call them the future because Yoruba will say, Osha, Taba Filomo Lowo, Konekwe Parun. And this set of people are wonderful people in this profession, young, energetic, and also they are very forward-thinking set of people. And one thing I've discovered since beginning of my relationship with PSN, this set of people, they love the chairman because the chairman always speak the truth. Yes or no? Please, let's welcome the representative of Young Pharmacists Group, YPG, and Pharm of the PSN. Please, a round of applause for them. YPG representative, I'm aware that the former chairman is here present. Please, we would like to have you to give your goodwill message. YPG representative, Young Pharmacists Group, would like to have, okay, while waiting for them, Pharm Victor from UCH, please let's us have you here for your goodwill message. Pharmacist Victor, please. All right. Please, a round of applause for Pharm Victor from UCH.
Good afternoon, everybody. Good afternoon to the chairman of the occasion, to our fellows here present. I will be standing to represent the Young Pharmacists Group, Oyo State Chapter, which I think I was already winding up my membership of that group, but it's a pleasure actually to be here to represent them. And on behalf of the Young Pharmacists Group, Oyo State Chapter, I want to congratulate the PSN Oyo State for this history-making event. It's one of its kind. I've been in Oyo State for a while, and this is the first time I'm seeing an event of this magnitude being hosted here in Oyo State. And it's a pleasure to be part of this event. I want to say to the PSN that the young pharmacists of Oyo State are proud and are happy to be part of you. And I think it's a worthy leadership we are having, and we are proud to emulate and to become what we are seeing ahead of us. Congratulations to the PSN. Congratulations to the PSN chairman. We are proud of you, sir. We are proud of the PSN. Thank you very much.
Well, Pharmacist Victor, you gave a speech as if you were really prepared for it. Please, a round of applause for him again. And now, this organization, I want to call out, they are representative. The fear of PCN is the beginning of wisdom. Yes or no? Because without them, you are not going to have your license. And without a license, you cannot what? You cannot practice. Please, they are watching, you know they are our watchdog. The number of applause you give them will determine if they are going to release your license next year. Please, I welcome the representative, the zonal coordinator, PCN, Oyo State, for PCN's goodwill message. Kelly, license back. Don't stop, if you don't want your license to stop.
Thank you very much. Good afternoon. I understand you don't stand on existing protocol. I want to recognize the fellow here present on behalf of the Registrar, Pharmacy Council of Nigeria, Pharmacists, Babasheu, Ahmed, Ibrahim, fellow PSN. Felicitating with you on this occasion of the scientific week of Oyo State PSN. Please let me recognize some people. I don't want to be rude. Please, my brother from, okay. Wale, you are very much welcome. God bless you. And please, I just want to facilitate to you. I want to recognize everybody. I want to congratulate the chairman on this beautiful program. And I want to believe we are all going to benefit from it. Please, let's concentrate. Let's listen to the lectures given. I believe we are all going to benefit from it. I wish you happy PSN Scientific Week. Thank you. God bless you.
Thank you very much. The Zonal Coordinator, PSN Oyo State, for that good message. Now I'll call to the podium Pharmacist Adekoya for another round of recognition of our guests. Please, a round of applause for him.
Thank you very much, the MC. While the good messages was going on, one important person also came in and is one of our pride. Former member, House of Assembly, Oyo State, Pharmacists, Leke Ogushola. You are most welcome. And also in this gathering this morning, there are some group of people here who are the top echelon of this profession. By virtue of what they have done for the pharmacy profession, they have bagged the highest honor of Pharmaceutical Society of Nigeria. And these are people called the Fellows of PSN. So this morning, every member of Board of Fellows of PSN here kindly rise up for recognition. Please rise up. We want to recognize you. Your service to the profession is not in vain. All your effort is what we are celebrating, and we want to welcome you specially to this meeting this morning. They are all BOF members, and that is the highest honor any pharmacist living or dead could be given in pharmacy profession in Nigeria. You are most all welcome. Thank you very much. You can have your seats.
All right. Thank you very much, Pharmacist Abiodun. And now I'll call on the PSN Secretary, Pharmacist Akala, to come forward to do some important things here. Please, a round of applause for these workaholic pharmacists.
Thank you so much. Good day, everybody. The chairman here seated, the chairman of PSN Oyo State, and representative of the president of PSN, you are most welcome. Permit me to stand on the system protocol. It's my singular honor today to welcome a special guest, a friend to this profession, pharmacy, and a friend to all of us. And it's not other person than Dr. Oluwaserimi Ajetumobi, the Commissioner of Health of Oyo State. She has always been a friend to this profession, and upon any slight invitation, she will oblige us. Ma, you will give your goodwill message, and I have the privilege, information of my chairman, that he wants you to declare this conference open.
Thank you, sir. Thank you, sir. Good afternoon, everyone. The chairman of today's occasion, the permanent secretary from Oyo State Ministry of Health, the director of Pharmaceutical Services, Director of Health Planning, Research and Statistics, the executives of Pharmaceutical Society of Nigeria, the deputy directors of Nursing Services, the fellows of Pharmaceutical Society of Nigeria, all our invited guests, gentlemen of the press, ladies and gentlemen, good afternoon to you all. I want to appreciate the Lord God Almighty for counting us worthy and giving us the opportunity to be among those that we gather here this afternoon as we have the opening ceremony of the 2025 Scientific Conference of the Pharmaceutical Society of Nigeria, Oyo State Branch. I'm happy to be in your midst, and I want to begin by commending the leadership of PSN, Oyo State Branch, for your unwavering commitment to excellence in pharmaceutical care. Your contributions to public health and your enduring support to our healthcare system in the Pacesetter state. You have not only shown up, but you have consistently stepped up. The theme for this year's conference, Building a Sustainable Future for Pharmacy Practice, is not a passive aspiration. It is a compelling call to action, especially now as healthcare globally undergoes transformative changes. Today's health challenges, from the burden of chronic diseases to the threat of antimicrobial resistance, are far too complex to be tackled in silos. Sustainability in pharmacy requires collaboration that transcends professional boundaries. Intra-professional unity enhances specialization, and also inter-professional partnerships. We also multiply and bring out positive impacts. When pharmacists are embedded in multidisciplinary teams, working hand in hand with doctors, nurses, med lab scientists, and other professionals, we are going to witness measurable improvements. There will be reduction in medication errors. There will be improvement in medical adherence or medication adherence, and there will be better outcomes. So we need to work collaboratively. In Oyo State, the Ministry of Health is fostering a culture of teamwork and shared accountability across all levels of care. Collaboration is not just a dilution of roles, but is a force for efficiency, safety, and excellence. I want to say here today that pharmacy is no longer just about products. It is about people. And at the heart of sustainable healthcare lies patient-centered care. Care that respects the values, the needs, and the voices of our patients. Pharmacists must increasingly serve not only as dispensers, but as educators, counselors, and trusted care partners. Every prescription filled should come with a conversation, and every medicine reviewed with a conscience. In the face of rampant misinformation, poor adherence, and rising out-of-pocket spending, pharmacists must become even more proactive, monitoring therapy, engaging families, advocating policies, and protecting patients' rights. This shift is urgent, and it is necessary. Technology is rewriting the rules of engagement in healthcare. We talk of AI, we talk of telepharmacy. These are no longer futuristic concepts. They are tools already reshaping pharmacy practice across the world. We are talking of AI. AI can predict drug interactions, can also optimize stock, guide decision making, and support pharmacovigilance. Likewise, telepharmacy. This offers lifetime or lifeline to rural and underserved communities and bridging the gaps in access and bringing expert pharmaceutical care to patients wherever they are. I'm confident that the outcome of this conference will not just be significant, but transformative in strengthening the bond between Pharmaceutical Society of Nigeria and the state government. As Commissioner for Health, I want to reaffirm the state government's commitment to continue partnering with pharmacists to strengthen our healthcare system, expand access to quality medicines, and ensure better outcomes for all. The government of Oyo State needs the collaboration of Pharmaceutical Society of Nigeria now more than ever. We see pharmacists as key allies in our mission to strengthen healthcare delivery across the state. One major initiative that requires your expertise is the soon-to-be assented Oyo State Drug and Health Commodity Management Agency. This agency is central to our strategy to ensure the availability, quality, affordability, and accessibility of essential medicine across all health facilities in the state. We cannot do it all alone. We need your inputs, your support, your vigilance to ensure that this supply chain is not only efficient, but safe, transparent, and free from counterfeit products. Equally important is the need to curb the activities of charlatans and unlicensed drug vendors. We see them all around us. They continue to endanger the lives of our people. And this is where your professional insight, regulatory knowledge, and advocacy are indispensable. Together, we must safeguard the integrity of the profession in Oyo State and in Nigeria at large. So our commitment to this cause is unwavering because one of the cardinal pillars of this administration under the able leadership of the Executive Governor of Oyo State, Engineer Seyi Makinde, FNSC, DSC, GSSRS, is health. Health is a cardinal pillar. Among the 4 cardinal pillars, health is one of them. And a healthy population is the bedrock of sustainable development. And pharmacists are crucial partners in making this decision a reality. In closing, I wish to commend the PSN Oyo State Branch for your leadership and foresight. This conference and your soon-to-be launched 550 million pharmacy house secretariat complex. These are testaments to your commitment to excellence, professional unity, and growth. I urge every pharmacist here today, let's see this conference to be another innovation, another time of collaboration, another time of patient-centered excellence. And together, we form a team, a formidable team, and we move our society forward. I wish you all a fruitful and inspiring conference. Thank you, and God bless you all. And on this note, I want to declare open the 2025 Pharmaceutical Society of Nigeria Conference to the glory of God the Father. Thank you, and God bless you all.
One thing about the Commissioner of Health is that she's a unifier. Please, another round of applause for her. There has always been a problem in the healthcare sector, and that is lack of collaboration. Right? But this woman has done a lot in Oyo State to ensure that there's unity in the healthcare sector. Thank you very much for all you do for us. And one thing I also take away from her speech that she said that anytime I have health issue, I should call her. So anytime you see my call.
Thank you very much. Yeah, thank you very much. Yeah, next on our agenda is the company presentation. I want to also use this opportunity to appreciate all our companies that supported this program. A round of applause for all of them, please. Yeah, permit me to call on 365 Biopharma. The presentation will be anchored by pharmacist Christian Obinna. Also, Ralphon's Pharmaceutical Limited should also get prepared immediately after the presentation by 365 Biopharma Limited.
Good morning, everyone. Permit me to stand on the existing protocols. My name is Pharmacist Adekoya from 365 Biopharma in partnership with Rafrons. So today, I'll be introducing our product to you, which is appetite and growth, and wellness and immunity. Then the third one, which is fatigue and recovery. So as we all know, we need vitamins and minerals for our everyday activities. So here comes our product, appetite and growth. As the name implies, appetite is something we need. We all know that appetite is the ability to eat, but some people are deficient of appetite, such as our young children, especially in rural areas, and therefore it leads to deficiencies and make them to be immunocompromised. So our product here is not only just for appetite, it's for appetite and contains all other nutrients that you can think of. So for us to achieve optimal growth and healthy appetite in children, it requires a holistic approach. So our product, Appetite and Growth, contains all essential vitamins and nutrients, such as vitamin A, which is good for growth, immunity, for eyesight, vitamin C, a potent antioxidant, vitamin D3, which is good for bone development and calcium intake, and also, particularly in our products, we do not only want your children or your kids or the adult to eat, we also want the brain to be developed. So here comes one of our potent ingredients, which is DHA EPA. Okay. So DHA helps with the brain development. EPA also, as we all know, is synergistic with DHA, produces and facilitates, bring about reduction in inflammation and enhances cardiovascular health. So clinical benefits of DHA, as we all know, it improves growth, neurodevelopmental outcomes in deficient or premature infants. And also it contains L-arginine, a precursor for nitric acid that helps with blood flow in our cardiovascular. And we have lysine, a potent protein synthesis and collagen for protein synthesis and collagen formation. So we have target audience for appetite and growth. First of all is active toddlers. Toddlers are always moving up and down, their energy. You will wonder, how is this children, how is the baby going from left to right, jumping up and down, and is not eating well. Here, our products will address that issue. And secondly, for the picky eaters, we have some kids that they will eat the egg white, they will not eat the yolk. Or they will eat white rice, they will not want you to put stew on it. So appetite and growth will address that issue. It will enable them to eat well and increase their appetite. And also for our busy parents, especially, most of us are medical people here, pharmacists, and we also have bankers, doctors, engineers. We tend to sit morning till night. And majorly, maybe we are busy, we only pick coffee or tea to drink. Then when we get home, that's when we remember that, I've not eaten. We also encourage you to please get this for your busy clients, such as your bankers and your doctors. And also we have athletes also. For example, our teenagers, they are involved in sports, football, and doing music and dancing. They tend to burn so much energy without actually replacing it back. Here comes our product again. Appetite and growth will address this issue. So moving on to our second product, which is fatigue and recovery. As the name implies, it targets specifically the young ones, the young ones that are recovering. Maybe any patient comes to your pharmacy or to your hospital, or they are just being treated for malaria or any infection. Fatigue and recovery brings about faster recovery rates. It contains 3 essential products that you wouldn't see in most multivitamins in the country, which is calcium glycophosphate, potassium glycophosphate, which they are essential minerals that enable the muscle to accept or enable the intestine to accept the multivitamins required for fast recovery. So, the role of key vitamins and minerals in energy metabolism and fatigue reduction. So we have vitamin B's in our fatigue and recovery. The B, thiamine, riboflavin, niacin, pantothenic acid, which is very essential for fatty acid breakdown and release of energy. Followed by vitamin C, which we all know, which is a potent antioxidant, is very critical to recovery. And we have our target audience for fatigue and recovery, which are students that are always doing night classes, they are sleep deprived. Fatigue and recovery bring about faster recovery rates, especially when exam is coming closer. We have new parents, for example, the new dads, because of the new baby that is in the house, they tend to be sleep deprived. They would not have time to be sleeping the way they normally sleep. And with that, they still have to go to work. And at the end of the day, they will be lagging at work. Fatigue and recovery brings about faster recovery rate and energy boosting. We also have our elderly patients, such as our retired bankers, retired pharmacists, that practically they are not doing so much, but they are always complaining of, I'm tired. Please kindly recommend fatigue and recovery for them. Then we have the fitness enthusiasts, which are those people that like going to the gym because they stress themselves, trying to have a particular shape of the body. There's muscle soreness, there's fatigue after workout. Fatigue and recovery will aid recovery and post-exercise stress. So the last one we have in our company, which is wellness and immunity. Wellness and immunity is basically to target people or clients or patients that are healthy. They just want to maintain their fitness and they just want to maintain a good health lifestyle. So we have wellness and immunity will help with bone and nerve health, metabolic regulation, and immune support. So our target audience for wellness and immunity is health-conscious millennials. And also after the COVID 2020, and people are very serious with their health now. They do exercise. They tend to eat right. They tend to sleep better. So wellness and immunity targets these health-conscious millennial people. And also primary school pupils, especially during this weather period. A lot of flu and cold is all over. Wellness and immunity is recommended for children that are always having cold, flu, catarrh, and all of those things. And lastly, we have senior citizens that are not eating well. Please recommend wellness and immunity for them. I want to say thank you for giving us the opportunity to come to ACPN Oyo State today. We appreciate everyone. We appreciate the organizers. And I want to ask, is there any questions before I leave? Any recommendation, any questions? Okay, thank you.
All right, thank you. Please, a round of applause before you go, because you've recommended your product to the pharmacist, and I want to believe that there are questions that people would want to ask you about some of these products. Please, we are going to entertain just 2 questions from the audience. If you have questions, please, you can signify by raising up your hand. All right, in the absence of questions, he said there is a promo. But if I'm going to announce the promo, the company is going to pay me. So as not to charge him, I will let him announce the promo himself.
All right. If you get any of the products, 4 of our products, you'll get one for free. We are just behind the all over there. Thank you.
All right, thank you very much. 365 Biopharma. Pharmacist Christian Obina. Please a round of applause for him.
Yes, thank you. Before the next presentation, sorry, let me quickly recognize our friend from Ogun State. Sorry, welcome with me, Pharm Mrs. Oyesunlola Okunuga, FPSN. She's the PSN chairman, Ogun State. And also a friend and colleague from Ife, the secretary, Pharm Charles Akinshete, FPSN. You are most welcome. And it's also my singular honor to welcome our guest speaker. She came some few minutes ago, and just in her normal self, she went to hide in the crowd. Ma, that was Professor Mrs. Chinedum Babalola. Please, can you come forward to occupy your seat, ma? Please help me encourage her. Ralph, phones, please. And also, I want to appreciate and recognize Dr. Wurola Akonde Sholabi. She's head of clinical department of UI, clinical department, pharmacy UI. Thank you. Ralph, are you set? Yeah. 10 minutes.
Good afternoon, everyone. My name is Christian Obina. I will be standing on the existing protocols here. Once again, I want to appreciate the organizers of this wonderful occasion today, the PSN conference we are having today. Once again, I want to say thank you all. I will be taking us briefly on a medication here that we will be using to address diarrhea. And I titled this topic, Management Guidelines for Diarrhea. And first of all, I believe we all know what is diarrhea. I don't want to stretch much on that. Basically, diarrhea here is the passage of two or more watery stool. And we see that more common both in children and in elderly ones as well. I think from the WHO guideline, diarrhea has been one of the leading causes of death, especially in children below 5 years old. And also, below 3 years old, there's an increment in terms of more of hospitalization for children below 3 years, but it's one of the leading causes of death for children below 5 years old. How do we, looking at the European Society of Pediatric Gastroenterology, Hepatology and Nutrition guideline for the treatment of diarrhea, that research was actually done in the year 2020. And looking at the methods and evaluation grade system, we could see that some of the documentation here states that Saccharomyces boulardii, that's S. boulardii, has been recommended in addition with the plain ORS to tackle the management of acute diarrhea in children. So I will not want to waste much of our time with this slide. So I'll just go straight to why we need to recommend NPU Trolite in treatment of diarrhea. So looking at the one of the methods, the guideline here, the treatment of diarrhea is prohibited for children because most people, I believe, when they are faced with diarrhea, their first point of call happens to be the community pharmacy. And I'm using the restroom. What can I do? And I believe the community pharmacy, like I said earlier, is the first point of call. And for NP Trolite, which is our molecule, I want us to acknowledge the content or what it has inside. In as much as it has the plain ORS formulation, there's a Saccharomyces boulardii inside that same formulation. And also it has zinc as well. I want to take us why NP Trolite. Why we should use NP Trolite to tackle diarrhea. So why NP Trolite? NP Trolite contains a combination of ORS and S. boulardii and zinc. And also, the probiotic there is the Saccharomyces boulardii, that's S. boulardii. And it's also a single formulation which meets both the oral rehydration and also a probiotic which effectively manages diarrhea. But like I said, the formulation we have here for this conference has a zinc already inside. So it's not just a double combination, but it's a triple combination to tackle diarrhea effectively, both in children and in also adults. Also, NP Trolite has an osmolarity of 227 SCV colonies. Traditional ORS, which also delivers osmolarity of about 245. Then also NP Trolite treatment targets, of course, why NP Trolite? We've known what NP Trolite contains. Why NP Trolite? Who are the targets or the people that we give this to? The children and also the adults. Then now, NP Trolite treatment target, what does it do when you take it? So, number one, the diarrhea is being addressed. That's two. Then also the electrolytes which the patient has lost. Because when you are going to the restroom for a couple of times, the patients tend to be weak and there's a lot of electrolytes imbalance. So it will help to replenish the electrolytes and also rehydrate the patient. The patient will be rehydrated. And lastly, the GI flora will be back to normal. That is the function of the S. boulardii. Just a moment. Okay. So in the treatment of diarrhea in children, Number one, in terms of the proven efficacy for this MP-Trolite, it reduces the diarrhea, the duration of diarrhea by 1 day. And also reduces the diarrhea, the rate of duration of hospitalization. Like I said earlier, diarrhea is one of the leading causes of death, especially in children below 3 years, and also, below 5 years rather. And also, it helps to also reduce the rate of hospitalization of children below 3 years. So in children with acute gastroenteritis, Saccharomyces boulardii tend to cover the benefits of several diarrhea symptoms. Then this is what MP-Trolite contains. The ORS formulation is there, the zinc is there, and also the Saccharomyces boulardii is there, which is in the strength of about 4 to 8 billion colonies. But according to WHO standard, at least the Saccharomyces boulardii should be in the range of between 4 to 8 billion colonies. Then dosage for MP-Trolite. Already here, we know the ORS, we use the normal 1 liter of conventional, 1 liter of water. But for MP-Trolite, you use MP-Trolite, 2 sachets of MP-Trolite in 75 cl bottle water content. That is how it's being used. And the 75 cl bottle water content, you can easily get or walk up to any pharmacy or any supermarket to get a 75 cl bottle water content. The likes of the small Eva bottle, the likes of the Aquafina, Aquarite. So the dosage, you reconstitute 2 sachets in 75 cl bottle water content. And also, it's easier to take, especially for the adult. You can even finish within the next 24 hours. But for children, in case they cannot exhaust for the next 24 hours, they can discard and prepare a fresh one. But the formulation must not last the next 24 hours. And also, there's more accuracy in dosing. That is why the 75 cl bottle water is being chosen. Because for the plain ORS, we discovered that when people are reconstituting, you have to do some measurement, and there will be a mistake here and there. So there's accuracy for that 75 cl bottle water reconstitution. Then also, again, there's power of synergism. So, and when we look at the formulation, ORS is there, the zinc is there, the probiotic is there, which is S. boulardii. And in some cases, when during my engagement with doctors, especially the pediatricians, most of the time they will write a probiotic, they will write an ORS formulation, and they will write a zinc. But MP-Trolite here provides you with all those combinations, so you can effectively get everything in one, making a 3-in-1 combination, both for children and also for adults. So thank you all for listening. So, and these are the various references here for MP-Trolite as regards to the WHO and other relevant bodies that you might want to know about. So thank you all for listening. And once again, before I leave, the MP-Trolite is available at the stand, and there's a promo going on. You get 5 boxes, and a box has about 10 sachets. So if you are getting 5 boxes, you are getting an extra 1 box free. Thank you all. So at this junction, I expect if there's any question or clarification. Thank you.
All right. Because of our time, the 2 companies that have done their presentation or product presentation here, their stands are outside. You can walk down there to ask them questions. And I know they have branded materials to give you, and they also have promos. So you can take home some product samples. Now, please, I want to sincerely apologize to the NMA. And now, thank you. You can go. I'm going to invite the representative of NMA for their goodwill message. Please, a round of applause for them. They are friends of pharmacists. We know they fight. They are friends. Thank you.
Good afternoon, Mr. Chairman of the occasion, and I would like to adopt the already established protocol. I'm Foluke Olani George, Vice Chairman of Oyo State NMA, And I'm here to represent Dr. Happy Adedapo, the chairman, who is unavoidably absent today. I want to really congratulate and celebrate all the esteemed pharmacists in the house. I was discussing with a friend outside, and I said, this is the first time I've been at a PSN Scientific Week, and I was told that pharmacists do it differently. I'm not disappointed at all. And I also said that you really, really reached, by saying you want to build a 550 million naira building. But if there's any association that can do it, I think pharmacists will be able to pull it off. I want to also say that on behalf of all the doctors in Oyo State, we thank you for your hard work, for your comradeship and your partnership in what we know is the very rugged terrain of healthcare in Nigeria as it is today. So many challenges are besetting us, but we thank you for your composure and your commitment to seeing this ship to shore. We pray that in our own time, we may be able to tell a different story, maybe in the not so distant future. So your theme is amazing. We looked at it together, myself and the chairman, and we realized that it's extremely topical and very relevant. When you talk about sustainability, it's a buzzword today, and the Honorable Commissioner has said so much, but there are just a few things that the chairman would like me to pass across to you. And the first is that for healthcare workers, we need to think beyond collaboration among ourselves, but we need to now start collaborating with policymakers and people that can get our good ideas, back on the table. So if we don't do that, it's as good as, time wasting. So let's collaborate with industry stakeholders, policymakers, and let's really get things done. The second message he has for you is that we should look at solutions that are sustainable, eco-friendly. It's no news, that the world is looking towards things that are low on energy, waste, managing waste properly, and the pharmaceutical industry also needs to look at ways that your practice can be eco-friendly so as to maintain the integrity of the environment. And finally, with respect to AI and technology, in a bid to ensure that what we do is effective, is efficient, we can't afford not to latch on to those solutions, digital solutions, artificial intelligence, that will make our processes more compact, more tidy, and in line with international best standards. So once again, I congratulate you on this wonderful celebration, and I wish you a very happy week. Thank you. God bless.
Thank you, ma. And I know after that speech, NMA will no more have concerns about pharmacists becoming CMDs of hospitals. All right, ladies and gentlemen, we are moving to the next item, and that is opening remark from the chairman of the occasion. So I will hand over to Pharmacist Ahmed to take over that.
While the chairman is on his way to the podium, I would like to call on Pharmacist Adekunle Rashida to please come to recite the citation of the chairman. You're welcome, sir.
Anthony Bola Oyawale, FPSN, FPC Pharm, FNA Pharm, graduated from University of Ife, now Obafemi Awolowo University, over 3.5 decades ago. He's a quintessential leader with proven track record of service to pharmacy profession and public at large. In the last 35 years, he has been in the vanguard of various struggles for entrenchment of ideal practice environment and development of the profession. Wale has been involved in the quest for better deal for healthcare practitioners in the health insurance scheme in Nigeria. He once served as Vice President of Healthcare Providers Association of Nigeria, ACPN. He has served in various capacities, including National Publicity Secretary of ACPN from 1997 to 2000, Chairman of Lagos State PSN 2005 to 2008, and is currently a member of the Board of Trustees of PSN and ACPN Lagos State. Pharm Wale also served as Executive Board Member of Lagos State Primary Health Care Board from 2008 to 2011, where he made innumerable contributions in the development of the policy framework for the establishment of Sustainable Drug Revolving Fund scheme in the public health facility. His service at the national level of PSN includes member PSN National Council from 2005 to 2008, Chairman PSN Strategy Committee 2012 to 2015. He was Chairman, Law and Ethics and PSN Desk Officer for Association of Professional Bodies of Nigeria, an association that is made up of over 30 recognized professional bodies in Nigeria. Wale was a member of PCN Governing Council in the last dispensation, where he also served in the Education Committee of the Council. He has been a volunteer pharmaceutical inspector of PSN since 2005. He remains the Chief Executive Officer of Barrett Associates Limited, and is happily married to a pharmacist with children, among whom is a pharmacist. Ladies and gentlemen, with a resounding round of applause, please welcome Pharmacist Oyo Anthony Imbola.
Thank you. Thank you. Thank you. Thank you. As men of honor, we join hands. I want to thank the chairman of Pharmaceutical Society of Nigeria, Oyo State Branch, our very own pharmacist corner, retired but not tired, Victor Olusegun Ajanaku, and the team for inviting me to come and chair today's occasion. And I use this opportunity to also welcome the keynote address speaker, our dear own Professor Peace Chinedum Babalola, FSA, FNA Pharm, FPSN. You are welcome. I welcome the representative of the President of the Pharmaceutical Society of Nigeria, Pharmacists, Tanko Ibrahim Ayuba, who is ably represented here by Pharmacist Maden Ladewaju Gafar, a son of the soil, the National Secretary. You're welcome. And I could see a past president in the house, the quintessential Olumide Akintayo. You are welcome. We have a lot of juggernaut in the house. I will have to adopt the existing protocol. But I cannot, without mentioning the League of Past Chairmen of Oyo State. I could see Pharmacist Ogunye, I could see Pharmacist Olunuga, I could see Lake Conversating, Ajibade, I could see Aisho Ishola, I can see Adeboyega, I can see those as far as I can see. We have worked together one way or the other, so I welcome you. I could see the past DPS here. I recognize you, sir. And our political juggernaut who has way in Osun State and is still making waves there. Old Leke, Honorable Leke Ogunshola. Well, I will not discountenance the importance of our zonal director of the PCN because he's the one taking charge of the regulatory affair here. Only last Thursday, we were at a program together somewhere in Ogun State, inducting some new pharmacists. Madam, I recognize you. Pharmacist Ajanaku must have been a soldier as he is, because once a soldier, always a soldier. To have commandeered the chairman in the Southwest Zone, the chairman of Lagos State, since he will not be able to come, and he heard that he has nominated one of his past chairmen as the chairman of today's occasion, said since he will not be able to come here, he cannot allow me to come alone. And has specially and graciously accepted that a past chairman of the state, fellow Familusi, and fellow Bolagade Yola has been dispatched to follow me here. So I thank you for following me, and I'm not here alone. Colleagues, I recognize other fellows in the house. And the theme of today's occasion, building a sustainable future for pharmacy practice, is very apt. It's very apt in the sense that in this landmark year 2025, new things have been happening for pharmacy. It is only this year that the major drug markets were sealed for some time. It's a landmark achievement. I think we should clap for pharmacy profession. Because it was during this year that the Pharmaceutical Society of Nigeria made sure that he worked closely with PSN and NAFDAC to make sure that pharmacy becomes a word in the front burner in Nigeria. And at the end of the exercise, we were all wondering where drugs worth $1 trillion could be gathered together in about 113 trailer load evacuated, which means the health of Nigerians are better for it today. I think we are having a sustainable future for pharmacy practice. Oyo State, being a pace-setter state, has been able to do wonderful things. It's a state that has recognized consultancy pharmacy in the State Ministry of Health. I think we should clap for them. And not only that, in the number one teaching hospital we have in Nigeria, the University College Hospital, I'm aware that we have more than 30 consultants who are already benefiting from what they have learned, and they are being remunerated for it. I think they deserve a round of applause. These are the handwork of what, as men of honor, we have joined us together to achieve, because it is a struggle. If the pharmacy has stopped at the dispenser level, the consultancy level we have achieved today, we would not have been able to get to that place. So, we thank the fathers of pharmacy, the living ancestors, as represented by one of them here, Pharmacist Olumide Akintayo, who is a major force when it comes to Joesu, that we have partnered with. And partnering with them has brought a lot of benefit for pharmacy. Yes or no? We can attest to that. And there are challenges, and there will still be challenges. But like our motto says, as men of honor, we join hands. And that's why the leadership in Oyo State has been joining hands with other states within its neighborhood. Today we have in our midst the brand new chairman of the Pharmaceutical Society of Nigeria, Oyo State, in our midst, and the secretary. Please, the two of you stand for recognition. Which means we are collaborating together. What a better way to harness our resources so that we can speak with voice, because there is strength in number. I recognize the fact that there will be challenges. And in the anthem we sang, Nigeria anthem, in the second stanzas, it says, our flag shall be a symbol that truth and justice reign, in peace or battle honored. There will be peace. There is time for peace. There is time for battle. And in political balance, they say power is never served a la carte. You fight for power. Our keynote address speaker today is a vice chancellor of a university. who say he cannot rise to become the Vice Chancellor of Earth Sciences University that are being set up today in Nigeria. But is that the case of what we are witnessing? From what is going on in our nation? Are pharmacists not qualified to be Vice Chancellor of whatever university we can think of in Nigeria? Pharmacists are versatile by training, and we are more than equipped to be the Vice Chancellor of any university anywhere. So, it is part of the struggle we have to engage in if we are going to sustain the future for pharmacy practice. It is in our hands. We must continually join hands together. In the anthem of Oyo State, we said we are pace setters. We are Asiwaju. Asiwaju Niwa, Asiwaju Niwa. That was how we rendered it. And for us to sustain that, we must continue to collaborate together. What we have achieved as pharmacists is small compared to what is in front. We must continue to collaborate together. And it is in our collaboration together that we can have a future that's going to be sustainable for pharmacy practice, that we can hand on to our children and those who are taking over from us. In my certificate, I say, I have a daughter who's a pharmacist. If all of us have children who are pharmacists, then we need to buckle up to make sure we have a profession we are proud of that we will hand over to them. It is a collective effort. The struggle will always be there. The challenges will always be there. But as men of honor, we must continually join hands together so that the future will be bright for our profession. When we started, pharmacists were labeled like 2 stars, 3 stars. It got a stage, the WHO label of 5-star pharmacists. But today, pharmacists that were labeled 5-star, 7-star, is now termed by World Health Organization as 10-star professionals. If they don't recognize the impact of what we have, we will not be advancing. So if we are advancing in the world stage, then we must continually be ready to advance in Nigeria. And we can only do is, wherever corner we find ourselves, whether you are in academy, whether you are in community, whether you are in industry, whether you are in politics, wherever you find yourself, the banner of pharmacy, we must carry it. We must carry it together and sing the song together so that as men of honor, as we are joining hands, pharmacy will be progressing. And I believe in your lifetime and in the lifetime of our children, pharmacy will continue to achieve better things. I thank you for inviting me, and I believe by the time we listen to the keynote address, we will have more things to ruminate on. And the panel discussants will be able to bring out more scientific points that will enrich us in the quest to sustain pharmacy practice. I thank you. Congratulations.
Thank you very much. Please, another round of applause for Pharmacist Anthony Bola Oyawale for that wonderful speech. I will say of the greatest Ife, sir. Of the greatest Ife. So, all pharmacists are from OAU. Of the greatest UIs. Of the greatest LASU. Of the greatest Ife. So, it means Great Ife has produced the greatest pharmacist in Nigeria. Please a round of applause for yourself. I'm actually proud to be a product of Great Ife. So, if you are hearing a lot of Great Ife here today, because our keynote speaker is also a Great Ife. So, this event is a Great Ife event. All right, ladies and gentlemen, now we are about to have... wait, is the chairman from Great Ife? Okay. We will make the chairman a great affair. All right. I have the honor to welcome the keynote speaker for this event. He's a female professor that has done so well in the profession, and that made her to become the first female pharmacist to be appointed as a vice chancellor. Please, a round of applause for her. I have the honor to welcome Professor Chinedum Peace Babalola, FAS, FAAS, FPSN, FIPAN, etc., etc. Please, a round of applause for her. And how we also welcome Pharmacist Dr. Mrs. Adekoya Fowoshi, DSA MAW, to take our recitation. And, when you produce good products, you always be proud. Doctor is a product of our keynote speaker. Please, a round of applause for her again.
All protocols duly observed. It is with great honor that I do this. The profile of our guest speaker, Professor Mrs. Chinedum Peace Babalola. Professor Mrs. Chinedum Peace Babalola is a globally respected pharmacist, academic, and trailblazer whose work has significantly advanced pharmacy education, pharmaceutical research, and institutional development in Nigeria and across Africa. A transformational leader, she made history as the first female professor of pharmacy and first female dean of pharmacy at the University of Ibadan, as well as the first female pharmacist in Nigeria appointed as vice chancellor, serving with distinction at Chrisland University. I think we missed a place to put a hand up together for her. Our academic journey began with a B.Pharm from Obafemi Awolowo University, followed by MSc and PhD in pharmaceutical chemistry, specializing in pharmacokinetics, a PharmD from the University of Benin, a postgraduate diploma in industrial pharmacy from Kilimanjaro School of Pharmacy and Purdue University, and an executive leadership management postgraduate certificate from the prestigious Lagos Business School. With over 4 decades of research experience, Professor Babalola has made pioneering contributions in pharmacokinetics, pharmacogenetics, drug metabolism, development of natural products, and new leads. Her work provides guidance for optimization of therapies for malaria, HIV/AIDS, sickle cell disease, and cancer in African populations. She has pioneered machine learning for drug design, modeling, and development. As a multi-grant awardee, she led the establishment of the Center for Drug Discovery, Development, and Production in the University of Ibadan by approximately $1 million Mercator grant, which developed innovative pharmaceutical products used during health emergencies such as the Ebola and the COVID-19 pandemic. As a passionate mentor, she has trained and inspired hundreds of young pharmacists, including myself, academics, and researchers, many of whom now hold leadership positions nationally and globally. She has about 120 peer-reviewed publications, more than 150 conference presentations, and 2 patents. As a transformational leader, she played a pivotal role in securing national approval for the Doctor of Pharmacy. That's the PharmD program in Nigeria. We all know that there has been a lot of weapon devices fashioned against it, but we thank God for her efforts and the efforts of others. While serving as the founding chairperson of the PSN Deans Forum between 2014 and 2017, under her leadership, Chrisland University experienced exponential growth and academic recognition, including establishing Africa's first accredited Doctor of Physiotherapy program. Her numerous accolades include being named on African Union Kwame Nkrumah Regional Laureate for Scientific Excellence in 2019. She is a recipient of the May and Baker Best Pharmacist in Nigeria Award and the WIMBIS 2022 5 Female Academic Achievers Award. She is a fellow of the Nigerian Academy of Science, African Academy of Sciences, Pharmaceutical Society of Nigeria, Nigeria Academy of Pharmacy, West Africa Postgraduate College of Pharmacists, Institute of Public Analysts of Nigeria, amongst others. Professor Babalola is married to Right Reverend Collins Olufemi Babalola, the Bishop of Ajayi Crowther Diocese, is saying, and they are blessed with wonderful children. Her legacy as a scholar, innovator, mentor, and visionary leadership continues to shape the future of pharmacy in Nigeria and beyond. So, ladies and gentlemen, just arriving from Akure this morning to honor this invitation, join me to welcome with joy in our hearts, peace in our minds, our spirits aligned, hope in our gaze, mind set to learn, and a thunderous ovation. Our keynote speaker, Professor Mrs. Chinedum Peace Babalola.
Thank you very much. I wish I can take a song that says, "To God be the glory, great things he has done. There is no me without God. There is no Chinedu without a Chi." I'm sure you understand that. Yeah. So all the glory goes to God. And I want to thank the organizers, especially Mr. Akala, who was on me. I should have been at IPAN today, Institute of Public Analysts, having a conference. Yesterday I was with Organization of Women in Women in Science in Developing Countries in Akure, Futa, where I gave the keynote speech. I came from there today. And I'm having this one, and there's another one in IPAN, but I don't think I will make that IPAN one because of this. So I had to choose this one above IPAN. I'll be apologizing to them. I want to pay tribute, recognition to wonderful pharmacists here. Pardon me, I don't have the protocol, but I maintain the existing protocol. But I want to recognize the number one pharmacist, ably represented, as well as the chairman for PSN Oyo State, who is here with us, and our legends that are seated here. You may not know, but Pharmacist Olumide has been, how will I call it, has been a support system to me, personally. Without talking to him, I didn't have any interaction with him. But in 2015, when he was on the board of UCH, without application, he nominated me to be a consultant pharmacist in UCH. I do not take it for granted. I'm very grateful to you for it. That was even before a lot of noise was being made. Even UCH, they've been playing pranks with it as I talk. But at least that goes into history. Thank you so much. Again, as a dean, without interacting with him, he just called me and said, come and head all the deans. I had very senior people there. Very, very senior people. And I was so shy. How can I head all these elderly professors that are my teachers? And they are deans. So I remember I used to ask one of them, you just be cheering, let me be at the background. But he gave me wings to fly. And at the end of the day, through other means, and that was when we all agreed that FAMD must come to stay. We did. Through that means, through NAFAM and other means, FAMD came to stay before I left the office. Thank you so much. Please, I would like my slides to start rolling. I want to say I'm happy. I'm a happy pharmacist. I'm happy to be a pharmacist. And my message is really, really short and small and apt. And that is to encourage all of us seated here to do things smartly, to be smarter. Are you getting my point? If it's going to take you 10 hours to go by road to Owerri, no, sorry, I'm mentioning Owerri. Why not go by flight? Hello. So we need to do whatever we do smarter. That's just the message. Okay. So that's just my message. Whatever you're doing, do it smarter. Find a way of doing it smarter, and then you will add value. Whether teaching or anything. I was teaching my students online last week, and it just dawned on me, why don't you just give them tests with Google Team? You know, I know how to do it, but I knew it was going to take me time. So I called a Gen Z friend. I said, I want to give them tests, open book, you know, but 25 questions in 20 minutes. They couldn't believe it. I gave them a few minutes to look through. Everywhere was quiet. And the lady in a jiffy gave me the online, and I posted it. I didn't care, because if you are checking for the answer, you won't finish. Hello. That's a new way of learning. Hello. I'm giving them notes that I was supposed to teach them today, but because of this, so I've given them their notes. Read it. When next we come, we'll have that kind of test. Sorry, I wanted to say praise the Lord. All right. So building a sustainable future of pharmacy. Before I did this, I sampled our young pharmacists. I wanted to say, what do you think? What should we be doing? I don't want to just come and give you. So I'm going to share what they are thinking with you. Are you following me? That's just what I would share with you. Next slide. I won't read everything because of time. Next slide. Remember, we're talking about smartness. That's just what. Yeah, so it's essential. Everybody has been talking about it. And we have our healthcare evolving so rapidly, even with rising burden of disease. Diseases are getting more complex. The more problems we have, the more we should be smarter. All right. And I just said, look, it's not all bad. I went online. I searched so many people. But because I want to limit my slides. All of you are doing fantastic. Really doing fantastic. And, yeah. And you can see some of the people doing very well. I was in WASPEN, although online, and you will be amazed how the people in nutrition feel that they should be the one that we make and dispense what do we call it? Intravascular, there's a name we call it. The food that we give them by IV. What is it called now? Can someone help me? Intra-Professional. I've got it. So, they were arguing. They should be the one to handle interparenteral. Can you imagine? Because it gathered people from different sectors, and it was good because they were now educated. Somebody said, look, that's like medication. You can't handle it. I worked as a tech pharmacists in the US, and we know what we do to prepare it. I've taken care of a patient in the US, and they just call pharmacists, they make it. They have to talk about sterility and all of those. So everybody's fighting to be one thing or the other. So we applaud Dr. Teresa Pounds for what she's been doing, even beyond the space. She was able to gather a lot of people together. Then CPAN, giving lectures every week, enlightening pharmacists. And then pharmacist, is it what's his name? Opeyemi, right? Akintayo, doing so well on point of care. And he has a faculty made up of different people from different professions. And when you go to that website, you need to see what people are saying. Their lives and practices are being transformed by a pharmacist. Then I have a young pharmacist, Taiwo Olawehimi, who graduated from UI. She's running a pharma incubation hub. She's doing fantastically well. We have our student here, Alonge, whom we have celebrated before for all he did. Pharmacists are doing well. Can we clap for you? Yeah. So, when you think about the future of pharmacy, what comes to your mind? Everybody, you can write it down. I don't have to answer that question. What future are you seeing? That's leadership question. What future are you seeing with respect to pharmacy practice? All of us should put on our thinking cap and look at it. I'm a lecturer. What's the future I'm thinking? Maybe you're a community. Even if you are retired, what is the future that you're seeing? That is leadership. What future do you want to birth? What future do you want, where do you want pharmacy to be in the next 1, 2, 3, whatever years? So our practice is characterized by a lot of white space. A white space is where unspoken or met needs of customers are discovered. So we still have a lot to discover. There is still a lot of room for innovation. You know, it's a business model that we need to uncover opportunities and improve healthcare. For everything we do, if we can have in our DNA, our brain, that whatever I'm doing is to improve healthcare. When I'm teaching all my chemistry, pharm chem, all the bonds moving, that's what I tell the students. I teach better now. After about 7 years, I don't just teach, I impart knowledge, action-based knowledge to them. You know, I was teaching them chromatography recently. And I said, you know why you do chromatography? It's not all the basic things that you see there. It's because we want our drugs to be of high quality. You don't want patients to take our drug and then they will have problems. And then I gave them a chromatogram. And I said, okay, discuss it. Everywhere was quiet. They couldn't discuss it because they couldn't apply the scientific knowledge to that chromatogram. They couldn't. They didn't understand why one column is 30 meters, another one is 10 meters. Why one retention time is this? Because we are not teaching them. We're teaching them to know. We're not teaching them to do. So we need to teach them to do. You know, so in my space, what do I want them to be? So whether in community, anywhere we are, we should always say patient-centric, collaborative, digital, personalized. Those 4 topics or points are very important. Let's imagine what pharmacy will be. This is 2025. In the next 5 years, 2030, there will be massive changes. Will there be fulfillment? Will there be risk management skills? Will there be alternative complementary therapy? Will there be change in the value chain? What areas of innovation do you see across the value chain? You must think innovation. We are so well trained. We are so smart. We are so intelligent. I'm proud of pharmacists. I'm proud to be a pharmacist. There is nothing we cannot do. Hello. Hello? So please think about that. What are the latest trend? We have what we call virtual reality, 3D printing. How many of you have seen 3D printing? How many? How many of us have seen 3D printing? I saw it at a TED Fund fair last year. And they brought a company called Technovate. And Technovate is wiring everybody. I didn't see any pharmacy. I didn't hardly saw any pharmacy group there. Everybody is poaching on our research studies. They've gone to use Technovate. And I saw 3D print live. I've been hearing it. And I want to also partner with them. And as you are there, you are thinking, okay, what can I do? You will see them printing a toy. These toys our children have. You don't need to mold anything. 3D printing, you design it. These young people are on the computer. As they are designing, it is printing. That's how we have our aircraft and all that. So telehealth, drones, artificial intelligence, digital prescription, robotics. When you get this, you should look at it. So we do have some technological advancements. You can check them up on the Go Mobile Health Solutions. It provides e-pharmacy services, distribution of medicines through mobile platforms. It's available in Nigeria and Kenya. My Medicine, My Dawa. Check them up. Then tech-enabled access to medication. The solution is called Zipline. Check it up. It's using drones to deliver medicines, and Nigeria is there. AI in pharmaceutical care, we have guideposts, and that is assisting with personalized care in diabetes. Tech-enabled supply chain called Figo. So check these things up and see if you can partner or learn from them. Blockchain in anti-counterfeit protection. Check it. So now, driving innovation requires strategic planning, technical advancement, and technological advance, patient-centric initiatives. I've said that a lot, so this is what we have here. And then people always talk about goal, SDG goal. So if you want to really link what we're doing to SDG goals or universal health coverage, we need to digitize, or else 2030 will hit us and we're nowhere. So check goal 3 and look at target 3.8. Pharmacists are critical. Yes, in that. Then I was talking to these scientists yesterday about digital technology ecosystem. We need to build systems in whatever we're doing, in schools, in wherever, hospitals. I was just talking to one of my former students here. She works in a dental clinic, and I told her, what are you going to do in that place? Do you know you can do something that they will remember you for? I was just telling her, you can apply tech. You can, I like disruption. You can disrupt the place. And they will not, by the time you are leaving, everybody will be applauding, applauding you. So anywhere you are, leave a mark. That's my own mantra anyway. If I know I won't leave a mark, there was something, a position that was, and I was to be, and I say, God, if you know that I will go there and I'll not be able to talk, I'll not be able to add value, please don't give me. Hello? Please don't give me. I know in Chrisland, I met 57 students, and they were in 300 level with only 2 faculties. And I said, no way. I was so ashamed. I'm the first substantive. They had like 4 professors coming and going. And immediately I calculated, how many students do I need for us to pay salary? We can't be going to the owners to pay salary. I could remember. And he gave me 667 students. And I started driving it. I was the chief advertising officer Hello. I went to Abuja. I said, we need to do professional programs. You have to wait till 90. I said, we are not waiting till 90 year. We want to start now. You know, if they gave me support, would have had pharmacies. And that's how we started. Do you understand? And today, there's no space. Before I left, I had rented 5 hostels outside the campus. You know? So, you must be changing people's lives for better. Hello. So, this is digital. These are the these are the definitions. For digital pharmacy ecosystem, interconnected use of digital technologies to improve pharmacy operations. Whatever. You know, I say you should be smarter. That's just it. Be what? Smarter. That's the message this afternoon. Just be what? Smart. We are smart. Are we not using our phones? Doing A, B, C, D. Let us be smarter in healthcare what? Delivery. Integration of software, hardware, data analytics, to enhance efficiency. Use this phone to be more effective. What are the components? E-prescribing, telepharmacy, automated dispensing using robotics. I was telling the student, I said, look, we've always had AI. You know, when we work with HPLC, GC, we have what we call auto sampler. That auto sampler is AI. You program it. So many years, I used it in the 90s in Canada. You just program it. It will run. Say, okay, it will run for 10 minutes. It will move by itself. That's AI. AI is not one big thing that you're looking at. We've always had it for so many years. It's not going to bite us. Are you with me? I've seen AI sweeping the floor of somebody, doing Hoover. Hello? Yes. Patient monitoring and adherence, data analytics, electronic EHR. EHR, my students designed EHR. And they were not pharmacists. They designed it in our entrepreneurship course. And today we use EHR in our clinic in Chrisland. We just got another company to upscale it, to do it better. So when you go there, you see all your record there. It's not any big science. So if you go to our clinic, boom, you put your name, it will show you the drugs, show you when you came. That's EHR. Our students designed it. And they are not pharmacists. Hello? Online apps and all that. Benefits. Improve patient outcome, increase efficiency, enhance accessibility, and so on. There are challenges, of course, cost implication, but it's not that expensive depending on what you want to do. You can start small. Data privacy is very important. Regulatory compliance very important. I don't have time. I'm giving you some countries where you cannot, there's a limit to which you can use AI because of regulatory problems. And then the Nigerian healthcare sector, I don't want to be talking about Nigeria. Let's just see how we can make Nigeria better. The only thing I want to say is that with 220 million people, this is a good place to practice AI. Are you with me? Some people are in some places that can't be reached. There are some places in our Isenyi area, you can't use vehicle to reach there. How will they get health care? We can use AI and spot them on. Are you following me? So, we must reach them. A significant challenge is the 11 million who currently have unmet health care needs. So, there are challenges. And there is global transformation. So, we need to align. You can't continue as it was in the beginning. It's now and ever shall be. So we are going through transformation. Even human beings, everything we do is going through transformation. You know, if you don't stop yourself, your phone will stop you. Are you following me? Everywhere you are, we're on our phone. If they should steal your phone here today now, wahala day. Wahala ni. So we need to look at 3 critical pillars: inter and intra-professional collaborations, patient-centered care, and strategic adoption of AI. That's what covers our topic today. So pharmacy must evolve. Not just say pharmacy must evolve. Tell yourself, I must evolve. So don't say pharmacy. I, Chinedum, Peace, Babalola, I must evolve. I must evolve. So we have a noble profession, like I said it before. We have brains. We've got brain. We've got knowledge. Yes, people say what we learned in school is so didactic, but that has made your brain to be open. Are you following me? All those things you talk against, they have made your brain to be what? To be open, so there's nothing you cannot learn. All the cramming you did, they've made you super. So there's really nothing you cannot learn. Hello? If you could go through pharmacy school in Nigeria and pass, I doff my heart for you. When I was in Ife, we were 165. The first result like this, only 10 people's names were there. Great Ife. Hello. I almost failed Pharm Chem. This Pharm Chem now that I am. They will say electron is moving. I say, how is it moving? I cannot see the electron. I can't see the electron. I could not understand. Those of you that know Como. I just could not. I could not appreciate it. And that's why I do pharmacokinetics. I want to do things that touch human beings. I don't do abstract things. Hello? Yeah. So I could not process it. The first test, I had 36%. And I said, no, Chinedu, you don't know this thing. Oh, you better look for somebody. And one day, it was even a repeating student I overheard him saying it. And I went to him and said, it looks like you understand these electrons that are moving. And I went to him and he taught me. And I just grabbed that concept. I didn't fail it again. And when the exam came, I had 70 something. So that year I had scholarship. Hello. Yeah, so we are good. We are strong. And you've heard a lot about inter and intra-professional collaboration. We need to design courses on this. I took a course under AfriHealth. I got a certification. And in that course, it's organized by people in Ghana and Kenya. We were taught inter and intra-professional collaboration. We need to learn it, formalize it, not just talk about it. Are you following me? How can we do it? ABC of doing it. Maybe, I need our MCPD to change. It shouldn't just be everybody comes, you register, nothing. We should put AI into that course, that program, so that by the time you finished, you are transformed. Are you following me? How can pharmacies really bring in interprofessional and intra? Intra is even terrible. I mean, from Akure yesterday, we had a meeting on triple helix. And I said, you don't need to go to big companies. Go to the SMEs. And what it means is that you are collaborating with the industry and with policymakers effectively. Why can't we in academia collaborate with those in community, in hospital, in industry, even at a low level? We are not taking each other's job. The more the merrier. And I'll continue to say it. When you throw us away and we are not practicing, we are just going to be giving your students, and you say, oh, you didn't train them to be pharmacists. How are we going to train them? If the enabling environment is not there, I may not be able to go to her community service as, it's not because I'm proud and be dispensing drugs. There could be other ways we can be engaged with AI. Do you understand? We can be involved in counseling. We can be involved. We can look at tools that we can use. Why can't we have intra-professional? These are things we should intentionally design. Design the curriculum And let us put it in our MCPD and practice it. Hello. Of course, inter-professional, we can't talk about it, so we can't over-talk it. So, integrate multidisciplinary streams. Anybody that knows me, I call myself collabo. I said I'm a collabo. I'm a collaborating person. I don't work alone. I work with people. I don't know how to work alone. And working with people has enhanced me. I work with doctors, nurses. Right now, I'm taking a course in genetic counseling. I've taken it before for cancer, and I'm taking a real course, not on genetic counseling for sickle cell. In that space is the nurses occupying it, but I told my mentee, let us be learning. Pharmacists should design their own genetic counseling with drug use. Personalized medicine. Are you with me? And teach it as a curriculum. So let's learn from these people. If you are reacting to one drug, you draw the pedigree. There are chances that you will react to this one. And we give it to community pharmacists, and you know how to counsel people. Hello. So, intra-professional, I've already mentioned that we have all our hospital community. Why can't we come together and share knowledge together? Not just at conferences like this. What I'm proposing is intentional. Let's stop the silos. Let us stop it. The tangible cost of disconnected care. It's expensive. You can imagine if we are providing care. I keep saying it. If we in academia too, we are providing care. The more, the merrier. You're not taking your job. The more, the merrier. So there is a gap, and it is expensive when we work in silos. We can disrupt that system. And there is power in genuine teamwork. There is a lot of power. In UI, when Ebola came out, the university brought up people that were heading big research centers like CDDP. There was one in virology. They brought us together and asked us to provide solution. It was led by a professor in virology. Quite all right. But when we got there, I said, which one can we do? Okay, we can get hand sanitizer. And so we got hand sanitizer from Reckitt. Immediately I called Reckitt, and they gave us. After we called, I said, why can't we make it? We can make it now. I just called somebody, come and teach us how to make it. And we started making it. And we're supplying the university. At least our voice. I can't be in a place where the voice of pharmacists is not heard. I cannot. I can't function there. I remember in my university, the doctors will just go. They will be buying drugs from, because we haven't got a pharmacist yet. We are not that big yet. But we are big now. So they will just be buying, and I will say, this person you are buying drugs, is he a pharmacist? They said no. I stopped it. And I collected names of pharmacists in the state, and I said, these are where you go to those places, even if it's more expensive, buy from them. Are you following me? So, very important. So, building innovation ecosystem, the triple helix, academia, industry, government. Industry can mean anything. It can mean pharma industry. It can mean hospital. It can mean regulatory. Government can also mean regulatory. So, I used to draw a diagram, academia, regulatory, and industry for CDDP. I had a diagram for it. So academia with research, industry, could be private sector, government is public sector. It's the in thing, triple, they're even having quadruple now. How can we bring in triple helix into our practice? And we are having handshake. Very important. Our pharmacy faculties should move beyond the didactic teaching. You will teach it, the basic teaching, but focus on practice. Practice-based learning. I've always promoted it here, and I remember for the Pharm D, that was what we proposed. We should learn in modules. But unfortunately, the CC mass came, The pharmacists succumbed to CCMAS. The medical doctors did not. So we went back to didactic. I don't know what is wrong with us. And they won't want to listen to you when you have a superior argument. So today, our students, let me tell you, to impart knowledge. And that's what gives me satisfaction. Just to impart knowledge. The wage bill is terrible. It's just, that's the only thing that gives me satisfaction. That these students know better. Are you following me? But we must make them professionals. So we are still, our department, we decided to take this problem to the dean. Please look at this problem. Don't allow us to be learning like this. Are you following? All right. So practice-based learning. I observe with sadness. I used to go around. I've watched how nurses learn. I've watched how physiotherapists students learn. I've watched how medical lab students learn. We don't learn like them. Hello. I was in a senate and the HOD of physiotherapy said, no, we are not graduating them. Everybody said no. Until they complete some cycles and science, we are not, and they put their feet down. Are you with me? So PCN should help us. Everybody should help us. They learn well. By 200 level, the nursing students can do so many things. They learn as can do. Not just can know. They have models. They can give birth. They have all the models for giving birth. I didn't see model in pharmacy. I saw it in one university in UK. So please, let us do better so that our students will be what? Confident. Hello. So that when they are talking with confidence. All right. Industry, I've talked about that. I won't waste time. Industry, and they don't do any R&D. All these foreign industries, they don't do any R&D here. They do it outside the country. But those of us here can do it. We should bring in courses like, I call it pharmapreneurship in our curriculum. So that we also will learn, equip students about business. I know we do business studies, but do it better so that we can make money. I don't want to see pharmacists not being wealthy. Me, the sector I am now, I want to learn how to make money because the people in Isen need money. Are you with me? And I want people to support. I want to go and learn. I've registered for one financial lecture yesterday. I want to learn how to make money. Hello. Yes. So the ultimate goal is to build a system that fosters wealth for others. In CDDP, we had a triple helix model. We had the academic institutions we collaborated with. We had NGOs and regulatory, and we have pharma industries. We had them. So we ran that, and now we went into public health through USP for the past 5 years, training and being trained with industry people on GMP. These are all the trainings, much more we did because of a USP grant. I was made the focal person. Even though I was VC, I had to also lead this training under USP. And that's community service. And then this is us in May and Baker. We went to the industry and we had trainings there. We went to EMSO. And so we saw things the way they are. We lecturers need to go to all these places and do refresher course so that we can teach better. Cultivating collaboration, I cannot say it too much. Patient-centered care, I cannot say it too much. At the end of the day, you want a holistic wellness for everybody. And that's, we thank God for Hepler, who introduced pharmacy care. Defining and implementing patient-centered care. It involves understanding and respecting patients' preferences, needs, and values. We need to provide tailor-made medication, counseling. I'm talking about genetic counseling now. Pharmacists should look at a course called genetic counseling in drug use. Hello. All right. Key elements, shared decision-making, continuity of care. This is the figure that really explains pharmacy patient care. And we see a lot of this in CPAN. When you attend CPAN meetings, this is what they do. I thank God that Professor, I think he's still here, Professor Adisa. Yeah, let's appreciate him. He said I was his project supervisor. I had forgotten. So, but he's a name in all of this. And this is what they tell us to do. Collect, assess, plan, implement. I don't know whether he's in CPAN. Are you there? Yes. Do you know that I went to do PharmD? I did PharmD as a VC. Should clap for me now. Because after we finished approving PharmD, I became VC. So, and they had only 2 tiers. So the first one I could not join. He said, I cannot labor for this thing and not do it. So I was going to Benin, I did exam, I did project as a VC. I came to UCH, I came to FMC, Abeokuta. I defended projects because I wanted to benefit from it. So we did it. I went to UNTH, Enugu, we learned all of this. So there's no end to learning. So significant, very important. You improve adherence, you reduce hospital admissions and readmissions, and your role expands, and that's what will help us with independent prescribing that is going on in UK and Canada. We can't just be claiming rights when we don't have the knowledge. Does that make sense? We can't be claiming rights when we don't have what? The knowledge. Work with these people, provide value. They will call you next time. That's what I do in my research. I work with doctors. So there are certain projects they will do, must call me. When they say they don't want to call me, I say, no problem. I'm not fighting for anything. Tomorrow they will call you. Are you with me? Because they know you are adding what? So when you work with them, make sure you are adding value. Make sure you are clocking the patients. Make sure you are telling them this happened. And then they will look at you. And they say, I want to work with you. Are you following me? The same with community. All right. Yeah, so there should be holistic hubs. I've talked about the Masters Institute, NTM. I'm not going to teach you all of these. These are things we already know. Then there's the AI and tele-pharmacy and you must embrace it. That's the future, and it's an enabler. It's an enabler in healthcare. It's going to help you free time for value-added services and engage the patient very well and deeply. It's all over. There's telemedicine. There's telepharmacy. You know, you can counsel patients wherever you are. You know. So, predictive analytics. Our children are saying data. How many of them are doing data in pharma care? And the community pharmacies, you sit on data. So all those things you're saving in your computer, they are data. Don't throw them away. Save in the cloud. That could be PhD work of people in clinical. Am I correct? Yes. Save them in the cloud. Don't lose. If it is not documented, it is not what? It's not done. It never happened. So we don't even say it's not done. If it's not documented, it never happened. So in the hospital, don't lose your data. Don't say I lost my data. And then automated dispensing, medical error prevention, clinical decision with 4 pharmacists, and you support for other healthcare providers. The issue of pharmacogenomics, that's the essence of genetic counseling. You know, by the grace of God, by the time I finished pharmacokinetics, I knew there was more. So I kept moving. From pharmacokinetics, I moved to pharmacogenetics, and I'm now doing simulation. We can simulate pharmacogenetics without going to the lab. We can simulate pharmacokinetics today without going to the lab. Hello. So we can use that to have an idea before we even go to the lab. Once we develop a new molecule now, we can do simulation and we can tell you, this and this will happen. So instead of going to the lab to sit on 1,000 molecules, by the time we finish simulation, you may have only 10 that will go to the lab. Let's clap for AI. So you don't need to waste chemicals, waste time. That's being smart. So we bridge gap, remote delivery of care is very important. During COVID-19, telepharmacy, became invaluable. Really, really invaluable. And we need to continue it. Some countries are institutionalizing it as part of standard practice. I don't know what's happening in Nigeria yet in that space. Our strengths in the AI age, I just say we must not be left out. Our students are doing a lot. I'll tell you that pharmacy students in UI, they are the most AI savvy in the country. Am I correct? UI. Are they not? They win hackathons. They win all sorts of things. They win international. I'm so proud of them. They started a bit of this. A lot of this when I was even dean, I just gave them, we want to speak. Please go and speak. We want to do research. Go and do. We want to do go and do. Write VC. I write. And today, you'll be amazed where they are. I came back in November and I watched our students compete in UI on hackathon. Out of the first 3, pharmacy came first, pharmacy came third. So they're doing well. So, what's a hackathon? It's developing software and it is time-based. It promotes creative problem solving, design thinking, simulating the real world, encouraging color. If you see them working on hackathon, they won't use phone. They are so interested in it that you will be amazed. It keeps them busy. But they are doing it. We lecturers are mock hackathon. So we need to go and learn it too. But I was glad the competition they had in February, they called me to be a jury and I learned a lot from them. Students gain confidence and ideation when they are doing. I've been in a forum of vice chancellors and they say in UI, pharmacy students are the best in terms of research. As undergraduates, they undertake research. They form clusters. They undertake research. All right. So these are some of the things they've done. Some of the students, these are their names and the prizes they've won. UI Pharmacy won the 3rd place, blockchain solution to curb counterfeit drugs. And another team won ResDev. I mean, they're doing well. Let's appreciate them. These are innovation and student-led solutions from UI. And so they are shaping the professional identity. And we continue to encourage them. But we need to support them. We need to train the trainer, even for the lecturers, so that we can have some of these things embedded in our curriculum. And then I'll end with this imperative for lifelong learning. The Board of Fellows meeting last week, I listened to everything, almost everything. I was online. I never stop learning. I keep learning. And Dr. Lere Bale, professor, talked about lifelong learning. That's the only way we can catch up. We need to keep learning. You know, he said venerable, it's not venerable. I don't know who typed venerable. So, he challenged us, even the elderly pharmacists, to keep learning. You are always ahead when you keep what? Learning. If you can use this phone. I was telling someone, my dad is 93 years old, and recently he said, my data has finished. And we give him, he can do WhatsApp. He can do at 93. Are you with me? He's not being smarter. Smarter. So we too, we should be smarter. So let's keep learning. So we need professional development. Like I said, these are some areas. This is happening in CVS in the US. My charts as well. On the right is SIMMAN that has to do with pharmaceutical education platforms. So we can even train ourselves. These are some topics we can look at as we reorganize our MCPD and make sure that we are applying some of this knowledge. So, sustainable future collective action. I've talked a lot about patient care, technology, collaboration, triple helix system. If we center our practice on the unique needs of each patient, we will improve outcomes. If we courageously leverage AI and telepharmacy, we will overcome limitations. So let us move forward. Let us allow the voice of pharmacy to be heard in Nigeria. Let people know that we exist. And our collective decision, dedication, and innovation today will, without a doubt, define the health care of the nation tomorrow. So this is the future, personalized medicine, blockchain, AI, and all that. So I think I'm done. Thank you. I tried to rush it so much.
I think she deserves a standing ovation. Please let's keep clapping till she gets to her seat. That was a wonderful expository lecture, eye-opening lecture. And ladies and gentlemen, at this juncture, I think Professor Chinedum Peace Babalola is now more of UI, despite being a product of OAU. I think we should do some genetic combination at this point. So she's now, I can now say she's a product of OUI. OUI. A combination of Obafemi Awolowo University and University of Ibadan. Please another round of applause for her.
Yeah, thank you very much, Ma, for the wonderful keynote address. Yeah, even though I'm also a proud graduate of Obafemi Awolowo University, I think it's high time I start considering another postgraduate studies from UI, so I can enjoy what the UI students are enjoying. Thank you very much, ma, once again. Next on our agenda is the speech from the PSN national president. However, before I call on the national president representative, I would like to call on pharmacists, Omobolanle Ajao, and other ALPS members to assist with the PSN anthem. ALPS members, please. APS, please pardon me. I'm still learning. Please pardon me. ALPS members.
No, let's wait for them. Excuse me. Oh. I want your face. Please, we expect all pharmacists to be upstanding, please. We are proud of pharmacy, yes. 1, 2. We pharmacists, we are proud of pharmacy. We members of a glorious PSN, Pharmaceutical Society of Nigeria. As men of we join hands for pharmacists, drug making, dispensing, drug retailing, wholesaling, drug detailing, pharmacy, drug advice, just name it. Nigerians are there. As men of honor, thank you. Up, ups. Yeah, thank you very much, APS members, Oyo State.
Join me to welcome the PSN National President, ably represented by the National Secretary, Pharmacist Gafar Madehi, FPSN. You are welcome, sir.
Thank you. Thank you. I'm delighted to be here amongst great people today. I want to tell you that the president of Pharmaceutical Society of Nigeria originally planned to be here, and until yesterday evening, that he had to call me that he's being held up in Abuja doing your work, you know, because it's in Abuja, advocacy here and there. So that was why, you know, he called me yesterday evening that I should represent him, even though I had my own invitation from Oyo State PSN to attend this program. So I'm doubling up as National Secretary because I was invited specially and also representing the President of PSN. So I want to congratulate Oyo State PSN. You have shown that you are the pace setter. Because looking at the topic, building a sustainable future for pharmacy practice, it is apt, just as has been said by the chairman of this occasion. And I want to tell you that pharmacists, we have done well in this country. We have done well. We need to recognize that we have done well, even though there are challenges. But this does not remove the fact that we have done well in this country. We have, you know, contributed our quota to the health system, and the struggle still continues to ensure that we have a very, you know, good health system in Nigeria. So the president sends his felicitations, and he asked me to also remind you that Oyo State is very dear to him, and he will want you in good representation at the coming national conference in Kano. You know, Oyo State has always been there, you know, politically strong, professionally strong. So we want you to be part of the delegations at the 98th Annual National Conference coming up in Kano. And it's going to be very, very exciting. And the conference, it has really, you know, the topic is related to this because when you are building a sustainable future for pharmacy practice, then you have to look at the workforce. The workforce, because these are the people that will deliver those values, that will deliver the professional services. So we are focusing on building a workforce for performance, collaboration, and innovation. We are also looking at the future. You know, so we want you to be part of this discourse. And at the same time, I hope, you know, because Professor Babalola has said a lot, and we have a lot of things to take home. And I believe that the repertoire or those that are taking notes, they will put all these points and then forward to us as PSN National, so that it will be part of what we are going to use to improve practice. So once again, I don't want to take too much of our time. Once again, I congratulate you and I wish everybody well. Thank you so much.
Thank you, Pharmacists Ayuba, Tanko, Ibrahim, the PSN National President. And thank you for also recognizing Oyo State as a very strong force when it comes to national elections. No Oyo block, no Oyo vote, no PSN. Yes or yes? All right. So anybody contesting, we are not recognizing us. You know, go get votes. All right. Now we are moving to another important aspect of this event, and that is the panel session. This session is very, very important, and I would like every one of us to participate because we are going to have fantastic panelists that are going to be doing justice to issues affecting our profession. So, ladies and gentlemen, with my colleague here, should I even call you my colleague? You're a pharmacist, I'm a broadcaster. All right. Ladies and gentlemen, I would like to welcome.
Yeah, just before we continue the panel session, we are pharmacists, and it's important to drive a nexus between business and our profession. So, and that leads me to the next very short interlude. We are launching a brand of table water. We all have it in our front. We all have it in our front. Distinguished ladies and gentlemen, today we unveil a simple innovation with a very big impact. The all-new 1 liter table-sized bottle water. We all have it in our front. Until now, we used to have the 50 cl, we used to have the 60 cl, 75 cl, and 1.5 cl. And this has been a major concern for us as pharmacists, especially when we have to give our patients bottled water to use to mix their ORS solution. But not anymore. With our new 1 liter size bottled water, you get convenience, accuracy, and efficiency, which is a perfect solution every time. No guesswork, no measuring hassle. It's more than just bottled water, it's hydration with purpose. Thank you very much.
According to the World Health Organization, the preparation of ORS should be isotonic to the human system. Unfortunately, most commonly available bottled water sizes of 75 cl and 1.5 liters result in hypertonic and hypotonic solutions when used. But at Tulip Pharmacy, we're bridging this gap with our 1 liter bottled water, designed to perfectly reconstitute ORS into an isotonic solution. Our 1 liter bottled water is not just about size, it's about purity. Sourced from over 200 meters beneath the Earth's surface and meticulously purified through cutting-edge processes, including reverse osmosis, ozonation, sand bed filtration, UV rays, and so on. Our water is as clean and fresh as nature intended. We also offer a range of other sizes to suit your needs, the convenient 50 cl and 75 cl for on-the-go hydration, and the 19 liters dispenser water for family use. Visit us today at Tulip Pharmacy Limited, opposite Obat Filling Station, New Ibadan Ife Expressway, Adekoya Ibadan, or call us at 0905-519-0889, 0905-539-2650. Tulip Pharmacy, going extra mile for your hydration and well-being with excellence. Make it isotonic.
Let's give a round of applause for Tulip Bottled Water. Now on to the next agenda, which is a panel session. Permit me to welcome our facilitator for today's panel session, which is the quintessential pharmacist, Olumide Akintayo. Pardon me for calling you by name, sir. FPSN, FPC Pharm, FNA Pharm, FNIM. You are welcome, sir. Also, I'll be inviting our guest panelists. The first of them is Professor Rasaq Adisa from the University of Ibadan. You are welcome, sir. The next on our list of guest panelists is pharmacist Dr. Omobolanle Adekoya Fausat from the University College Hospital. The last but not the least, pharmacist Oladigbolu Adewale Aderemi, the former ACPN National President. Where is he? It's not. Okay. Yeah, well, we'll continue for now. Hopefully, it will join us before the end of the session. So we'll be having a short presentation from our guest panelists while our facilitator will anchor the question and answer session.
Oh, okay. Good afternoon, sir. The facilitator, the chairman, PSN Oyo State, kindly permits me to stand on the existing protocol. I've been told I have 10 minutes for this presentation. So in the next 10 minutes, we'll be talking about building a sustainable future for pharmacy practice, the place of patient-centered care in achieving this. Next slide. Okay. It's working. All right, thank you.
Also, protocol and flow. The chairman of the panel.
The chairman, PSN, the chairman, PSN Oyo State Branch, fellows of the PSN. I just felt it will just be our purpose to give a few opening remarks before we kickstart this session. And let me start by attempting to draft the National Secretary of the PSN, who is an eminent community pharmacist, to stand in for pharmacist Wale Oladigbolu, the immediate past chairman of ACPN, who is apparently unavoidably absent. It's not in the character of Pharmacist Oladigbolu not to honor invitations like this. I only wish, one of the, sometimes I'm brutally frank, and you will have to pardon me. One of the main reasons are so many conferences and programs are never impactful is that we tend to switch off at the most critical moments. Now, if you look at the number of people left to participate, the number of those of us who are participating at this moment, you probably understand what I am trying to talk about. I think the theme of this conference is one of the most topical subject matters we need to deal with in pharmacy, in contemporary pharmacy practice. And I think you would not have had a better person to handle it than Professor Babalola. Let me attempt to come from another dimension. And that has to do with the dimension of the workforce in pharmacy. What are we doing? I mean, I believe at least more people followed while that subject matter was being tackled. Now, one of the biggest problems we have today in pharmacy, believe it or not, is the quality of the workforce. From academia, what type of academics do we have? Professor Babalola places maximum premium on academics who don't even practice core pharmacy. You look at a situation whereby, and these are some of the reasons some of our existential adversaries have a lot of confidence. They practice what they teach, and they are well rewarded for it. So how do we change the status quo? I look forward to see many more of our academics being appointed as consultant pharmacists who walk into hospital wards, who practice in other critical areas of pharmacy. And so, how do we begin to achieve these things? I think one of the critical areas is that we need to take possession of pharmacy. I read in Agony some times ago how our friends in medicine derided us openly by saying they will no longer train pharmacy students at undergraduate and postgraduate level. I think there is a device. So, I think one of our biggest priorities moving forward from 2025 is that we must develop a pharmacy workforce that is structured to train pharmacists at undergraduate and postgraduate levels, so that we begin to produce world beaters in hospital pharmacy, consultant pharmacists within the bracket of our hospital walls who can compete with the best anywhere in the world, community pharmacists who are acclaimed as global experts in that realm, that will bring in the speak to anybody on contemporary matters in public health and all that, and they are up to par. And I think, I know you already have your scripts for this, but this exercise will continue. It's not going to end today. And I think these are challenges we should all take on, that we should ruminate about. I am aware that the PSN at national level has developed a team around workforce, pharmacy workforce for Kano. And I think this is one of the major reasons. I think as we go on, we'll throw more light on this. So let me welcome you all to the world of our distinguished panelists. And I'm sure you have a great time. Thank you very much and God bless. So on that note, let me invite you to continue with your presentation.
Thank you very much, sir. Thank you very much, sir.
Sorry, this is very important. Please, we want our colleagues to come and sit down. We know we've spent good time here, but please, come and sit down so that we can serve lunch. We want people to leave the exhibition booth to come back and sit down so that you can serve lunch. Please. Thank you.
All right. Thank you very much. So in the next 10 minutes, I'll be talking on building a sustainable future for pharmacy practice and the place of patient-centered care in achieving this. Okay. I don't think this is working right. Okay. So the objective of this talk is to explore how patient-centered care is a critical imperative for the sustainability and continuous evolution of pharmacy in Nigeria. And I'll be talking on what I'm referring to it as PCC, patient-centered care, what it's about, the core principles, the benefits that we stand to gain when we practice PCC, the challenges that we can encounter in Nigeria, and the strategies for integration of PCC in our different practice, our roles as pharmacists, and then I'll conclude with a call to action. I'll try as much as possible not to give too many patient case scenarios due to time constraints. Okay, so the World Health Organization defines patient-centered care as care that is respectful of individual preferences, needs, and values. And the key components mainly are empathy, communication, shared decision-making, and holistic care. So in light of this, it's not just looking at what is wrong with the patient and what can I do to help this patient get better. Also, what matters to that patient? What are the religious beliefs, the perspectives, the emotion, the financial capability of the patient? All those things are important and they know to go into patient-centered care for us to be able to achieve it. So patient-centered care is essentially a model for providing health care that focuses not only on the patient's symptoms and medical history, also on their emotional, social, and financial factors. that affect their daily life as well as their values. I remembered one particular clinic encounter that a patient was prescribed injection liraglutide, and a pen of that injection is 40,000 naira. When I calculated the dose, I realized that the patient will be needing 2 pens every month. So I asked her if it was okay with her, and she said, yes, it's okay. But I decided to engage her further, and then I told her if she has any other questions or clarification that she can just let me know. And she asked me, once I'm done with these 2 pens, will that be all? Then I knew that the cost was actually a problem, because if she could afford it conveniently, the doctor has already told her that she's going to be taking this medication probably for life or for a very long time. So I had to go back with the patient to see the physician to let him know that the cost might be a problem, because there are some instances where we feel that, okay, we have a patient that has heart failure and this is the best medication for this patient, but the patient cannot afford. Maybe they can source for funds and get what they will need for maybe a month or 2 months. But in the long run, there is not going to be persistence. So it's better to switch to a medication that the patient can afford and continue to use so that there can be adherence and there can be persistence. So it is a partnership. It is essentially a partnership between the patient and the healthcare provider, okay, in which the patient's perspective is just as important as that of the healthcare provider. The first principle of patient-centered care is respect for patient values and preferences. For instance, if I have a patient whose religious belief does not permit him to use anything that is from porcine origin, for that kind of patient, I cannot be recommended injection heparin or injection clexane. I have to look for a substitute that the patient is comfortable with. Because in Nigeria, our patients are not very litigious. They don't litigate. But now we are having increasing cases of litigations, even here in Nigeria. Because as pharmacists, for performing our pharmaceutical care rules, we know that we take responsibility for any medication that we dispense to the patient. So it's no longer an error of the doctor wrote the prescription. I'm the one giving this medication to the patients, and I have certain responsibilities also. So coordination and integration of care, it's very important that all healthcare members, the doctor, the pharmacists, the nurses, the laboratory scientists, collaborate efficiently and put the patients in the center. WHO has told us that the patient is also an integral part of the healthcare team. So the patient has to be in the center, and our focus has to be helping those patients to reach their goals. Information, communication, and education is also very important to make sure that the patients have the information that they need in order to help them to self-manage their condition, particularly for patients that have chronic illnesses that have to take their medications for life. Physical comforts. Recently, I think about a few years ago, WHO added pain score to the list of vital signs. A patient is supposed to be free of pain. And it's also very important that they be attended to in a place that is neat, where they are comfortable, where their privacy is assured. All these are some of the principles of patient-centered care. Then emotional support. We know that when patients have physical illness, it increases their fear and anxiety levels, and it wouldn't help in self-management. So when you have a patient that is emotionally stable, emotionally secure, they can participate actively in improving their own health. So the last but not the least is family support. 2 years ago at the University College Hospital, we carried out a research on the effects of family support on patient adherence and the control of their blood glucose level. And we found out that patients that have a high level of family support had better adherence to their medication and thereby had better glucose adherence. So it's very important that patients have family support in ensuring that they reach the goal of their treatment. Okay, so let's look at some of the benefits of patient-centered care. There are benefits to the patients, all right? The patient is going to have improved health outcomes because they will adhere better to their medication. There will be reduced adverse events. They will understand why and how they will use their medications. They will have greater satisfaction and trust in the entire process, in the pharmacist, in the medication you are handling to them, because you are going to reach a decision together to place them on that particular care plan. And that way, they will feel empowered and they will feel valued. Okay? And they also have better understanding and can make informed decisions about their health. For patients that have diabetes, we know that they have to consider their diet, exercise, and their medications. It's a lot. For some of the patients, they can even go into depression because they start asking you, does that now mean that I can't eat this, I can't eat that? But if at the beginning of the care plan, you sit the patient down and then you have a common goal and then make the decisions together, it's easier for them to adhere and then contribute to their own health. And of course, we'll have reduced hospital readmissions. the patient will have proactively manage their own illnesses. So for the pharmacy profession, we'll have expanded professional roles. We are not just dispensers. I remember when I was posted to the medical outpatients unit as an assistant director, that most of our recordings and documentation is about what we dispense. So I started thinking, I do a lot of counseling, I tell patients a lot of things. How can we devise a means where we'll also document our counseling session? So I spoke with Professor Adisa and Dr. Ajay, and they gave me a template that we can use to record our counseling sessions. And today we have about 5 pharmacy students who are doing their projects with the data that we have collected in the past 5 years. And I think that is something that we can emulate and reproduce in other teaching hospitals. So we'll have increased job satisfaction. This will just be take 2 in the morning, take 2 in the afternoon, take 2 in the night. You have job satisfaction because you're actually contributing to improving the lives of people. And then improve interprofessional collaboration. We'll be recognized and integral our team members. When I started in MOP, I used to write a lot of, I call them love notes. I'll write to the physician. I will see an obvious drug overdose, but I'll just write, kindly review the dose of this medication. Then in bracket, I'll say the usual daily dose is this, the maximum daily dose is this. And then they will correct it on their own. And usually, most of the time, they will write thank you. After a while, they called me and said, come and give us a presentation on the role of pharmacists in managing diabetes. And I did that during the ground round, and the same mark was very, very impressed. In that small cubicle in the pharmacy, you are doing all this? Say, yes, we are doing it. So it's important that we document. It's important that we communicate what we document. So greater recognition, value for cognitive services, not just the products. So for the healthcare system, we are going to have a reduced healthcare cost. If our patients don't have complications, they are not going to keep coming back to the hospital with a lot of problems. And then improve public health indicators, better disease management and prevention, and more efficient resource utilization, and stronger primary healthcare foundation, where pharmacy is a key player. So some of the challenges that we can have in Nigeria, the first thing is that we place a lot of emphasis on our dispensing roles, and we don't remunerate pharmacists for their cognitive services. So we need to look into that. And then also limited training in clinical care. We know we have our MCPD, the West African Postgraduate College is there, but how many people can actually, go in for this program without having to maybe take a leave of absence from work and juggle all of this? We need to look into all these things. Then fragmented integration with the healthcare team. Like at the University College Hospital, in some sections, we have full integration where the pharmacists go on rounds with the physicians, but it is not hospital-wide, and we don't have that in all of our hospitals. So it's worth looking into to ensure that we have a full integration with the clinical care teams. Also, issue of accessibility in rural areas and overburdened facilities. Then limited technology. Ordinarily, all of these highlighted points would improve if we had the adequate technology, but unfortunately, we have limited technology also. So some of the strategies for PCC integration in practice, education and training. We have our MCPD, intra-Professional education can also come into play. We have the West African Postgraduate College of Pharmacists, and now we have even sub-specialization in the college. It's not just clinical pharmacy production. Even within clinical pharmacy, we now have endocrine, cardiology, and all of that. So it will help us to improve the quality of service that we give to our patients. And of course, policy and regulation, if we have standard operating procedures, government backing, and all of that, it will also help in ensuring that we integrate patient-centered care. Of course, technology and evolution. Professor Babalola has already said so much about this. Collaboration and partnership, we cannot emphasize that enough. We need to collaborate with ourselves, intra-professional collaboration and interprofessional collaboration, enhance pharmacist-patient communication, and strengthen advocacy. And I must say that I'm really proud of PSN, both at the state level and at the national level, for the quality of advocacy that they have been giving us in the past few years. So some of the barriers to implementation: limited patient engagement, staffing shortage, like our living ancestor just mentioned now, staffing shortage, intra and interprofessional rivalry, inadequate healthcare infrastructure, pharmacist inertia, and lack of remuneration for specialized services. These are all things that can hinder the full implementation of patient-centered care. So our role as pharmacists, there are a lot of things that we can do. I just started to put a few things: providing medication therapy management, monitoring adverse drug reaction, offering preventive services like immunization, effective collaboration with physicians, nurses, and all other healthcare providers within the healthcare sector, detection and resolution of drug therapy problems, and so many more that we can do as pharmacists. So this is a representation by Sipel et al. And essentially what they are saying is that when patient-centered care is applied to medicines, what we have is pharmaceutical care. So we can say that as pharmacists, when we practice patient-centered care, we are essentially practicing pharmaceutical care. So in conclusion, patient-centered care is not a buzzword. It is the cornerstone of a sustainable, resilient, and effective pharmacy practice in Nigeria. And this journey will require us to be committed, to collaborate, and have a willingness to embrace change. And the destination for us will be a healthier, more engaged populace and a thriving pharmacy profession, which is undeniably worth the efforts. Let us collectively champion patient-centered care as the bedrock of the future of pharmacy in Nigeria. Thank you.
Distinguished colleagues, I think she deserves a better round of applause. It's not particularly easy to put these things together. You know that stuff, the keynote address by Professor Babalola appeared to be a tea party because of the ease with which she was presenting. But I can tell you, that must be a product of over 10 years of cumulative research and experience that she brought to bear. So please let's appreciate Pharmacist Adekoya. Yes. I will give the National Secretary some more time to get his acts together because he was drafted into an emergency assignment. I have no doubt that he will deliver. But let me invite the professor, the distinguished professor and researcher. Can I have Pharmacist Akala here? Pharmacist Akala, Secretary PSN. Prof, please, you have the floor.
There's a slide. I hope my slide is there. I don't even know. Devices and yeah. Is my slide there? Oh, okay. Yeah, good afternoon, colleagues. Without wasting much of our time, I would like to start on the existing protocol. But before I start, I think I would like to thank the PSN executive for considering me worthy of being part of the panelists today. The topic before me today is on building a sustainable future for pharmacy practice, how best it can be achieved in the era of artificial intelligence and telepharmacy. The 10 minutes they give me might not be enough, but again, I will try as much as possible to focus on salient points, why the slide can be shared among the interested colleagues that want to get more enlightened on the topic of today. How is it? Hello? Okay. How is your, hello? Oh. How is your something? Okay. Artificial intelligence generally, we are all aware of it. We know what exactly it is. But again, I will go into some little basics so that we understand details how AI actually performs its operation. Generally, as a form of introduction, artificial intelligence and telepharmacy, which is the topic given to me today, as we all aware, are reshaping the healthcare delivery globally because of the innovative approaches that this emerging technology can provide for us, especially as it can help us to enhance patient outcome, improve access, optimize pharmaceutical care services, and more importantly, enable us to generate accurate and data-driven clinical decision-making. That's key. So, building a sustainable future for pharmacy practice, which means that all of us, no matter where we are practicing, we need to ensure that we are prepared and well informed so that we can actually embrace this emerging technology as we are moving forward in our practice setting. For the purpose of this lecture, what I did is I know AI is applicable in different sectors of pharmacy profession, be it drug discovery, drug development, drug production. But for the purpose of this lecture, what I did is just to narrow it down to how we can use artificial intelligence in direct patient care. Some of the evolving role of pharmacy, as we are moving to the future of pharmacy, what are the evolving role of pharmacy in which AI can be of assistance to us? Because some of the complex tasks we think is complex, something like medication reconciliations, medication therapy management, personalized treatment, which by now maybe we consider as an complex task for us. AI can be of help in solving those problems. What is happening? Okay. As a form of brief enlightenment, what is artificial intelligence? All of us keep on saying artificial intelligence, artificial intelligence. It simply means ability of machine to what? To simulate intelligent human behavior. That's what it's doing for us. So just simulate human intelligent behavior, which means technology involved in programming of machine that enable them to act like human and perform some of the actions that human being can do. But the advantage is that, unlike human, it can accomplish short tasks within the real time, which means instead of looking at many times to solve a problem, with artificial intelligence, we can achieve those tasks within a twinkle of an eye. And that's the advantage it has. But as good as it is, we say AI system, the advantage is that it can learn and understand and can even respond to human emotions and perform multiple tasks within a very short time. Which means embracing it will allow us to solve many problems within a very short time, unlike when we're using our brain to achieve that task. So generally, we have AI system, we have AI package of solutions, we have AI algorithm. Those are the three major things that we need to know as far as we are using AI. Because all of us are just saying AI, AI, AI. What exactly is in AI that makes us to perform a specific task? And that's the algorithm. The AI algorithm that is actually embedded in AI package or solution is what actually performs the task, which means it's the engine or logic behind artificial intelligence. Every AI solution or package have an algorithm. That algorithm is the procedure inbuilt in that system or solution to achieve specific tasks, which means without the algorithm, the AI will not be useful. So it's important that we need to do that. That's why we call AI algorithm is the engine or logic behind artificial intelligence. Which means as a pharmacist, if you have a particular task that you want to achieve or accomplish, all what you need is just to describe it to your AI developer, who will now look at that thing that you want to achieve and design a AI solution with the algorithm, which is the engine that actually do the real task. So it's important that we need to know that. So as pharmacists, all what you need to know that identify the task that you want to achieve, which using your own human brain might not be able to accomplish within a short time. And we need to actually do that. AI will solve that problem for us. And we're able to accomplish that task. So without wasting our time, just like I said, I focus my... I don't know what's happening with this. Anyway, I focus my own presentation on the evolving role of pharmacy. How do we use AI to achieve some pharmacy operations that we think are innovative in pharmacy practice as we are stepping into the future of pharmacy practice? One of them is medication dispensing and inventory management. With the advent of AI, we have some automated robotic dispensing systems powered by AI, which are capable of accurately counting, packaging, and labeling medications. So which means if you are a pharmacy at this stage, and your whole skill that you have is dispensing, which means over time, we might be dispensable. We have to look for other skills, because with robotic dispensing system, it means that such activities can be taken over by robots, automatic robots, as a result of AI power software. So we need to actually be looking ahead of that and see which other tasks or role can we do for us to continue relevant in healthcare space. Aside from medication dispensing and inventory management, a high-power system can also do something we call medication verification and patient safety, which means with AI now, with our emerging technology, we can accomplish this because of the ability of AI to access a vast number of data and compare it with patient record and other medication database. It means that with AI, it can help us to detect discrepancies, at the same time, flag potential drug interactions. So with AI solution now, it means that some of these tasks that we think is complex for us to do within the very short time that we have, if you have AI installed in most of our operations, it can help us to achieve this particular aspect of our task, which I imagine or evolving role of pharmacy as we are building the future, a sustainable future for pharmacy practice. Aside from medication verification, predictive analytics and early intervention, which means with AI now, because of the ability to access vast number of data within a very short time, and they can actually classify those data, and they can predict outcome, which means that once they are able to tell us this is the trend, this is the pattern, and this is the kind of, they can flag patient at risk, and with that, we can actually provide early intervention to solve that problem. So these are some of the benefits that can be accrued from AI-powered software or packages. Then we have personalized treatments. Medication adherence is part of the thing that AI can do for us. Because there's some AI-driven solution now that can actually be weared by a patient. And we can actually track our patients, we can remind them through AI package software, and those are the advantages that can be beneficial from AI. There are many other evolving roles, something like AI medication reconciliation. Medication reconciliation is something that we need to do as pharmacists as part of our patient care activity, patient-centered care activity, because that will enable us to see any discrepancies with respect to medication, and whatever error that's coming alongside, we can actually do that. With AI now, based on machine learning, they can actually help us to reconcile patient medication across care transitions, which means that ordinarily, if a pharmacy work in a particular place, we consider this activity as complex before. But with AI package solutions, we can actually achieve this within a very short time, and we'll be able to achieve our goal in terms of enhancing patient outcome. Then AI chatbot and patient engagement. This is interesting because some of these features of AI, because AI has the ability to actually mimic human conversation scale, which means it can actually act like human, since it can respond to human emotions. So it can actually talk as if it's a human being, since it's designed in such a way because of that ability. Okay? But the good thing is that as we are rolling out all these benefits of AI, we need to consider some potential barrier associated with the use of AI. And one of them is that I said AI algorithm is the one that's logic behind any of our AI package solution, which means that if you over-reliance on AI, what will happen? If AI takes decision for you, and you take that decision, hook, line, and sinker, who is going to be liable? It's provider. So as much as possible, we have to be very careful. If you over-reliance on AI-generated decision, we are the one that will still take responsibility if AI make error. So you can't just over-rely on it. Whatever information is given to you, you have to verify it. Because liability lies on you as a provider. Responsibility for patient care still lies on you as a provider. So we need to actually consider all those advantages that it has alongside some of the barriers that have been able to roll out. Probably because of time, I may not go through all of them, but I don't know what's happened with this. Anyway, one of the things that I said as barrier, apart from liability, we still have data security and patient safety. Because as pharmacists or provider, we have access to sensitive data relating to patient, which means that as much as possible, we need to be careful about the safety of information that we're actually giving to AI to predict for us or to analyze for us. So whatever we want to do as pharmacy, whatever task we want to accomplish, it means that we have to work in collaboration with the AI developer to tell him what we need, the task we want to accomplish. And we must have understanding of the algorithm that's going to be installed in such AI package that we want to embark on. So that at the end of the day, we can trust whatever decision that's coming out from AI-generated decisions, so that we will take responsibility for such. So it's important that we need to do. Hello? It's not moving very well. I don't know what's up. Okay. Yes, just like I was saying, as good as AI is, there are some barriers that we need to go alongside with it. I've talked about the ethical and legal consideration, which means that whatever AI we want to actually apply to achieve our task, we need to understand how the AI perform its function, the limitation of AI, as well as we take responsibility in case of any liability. One of the other challenges or barrier with AI is integration with the existing system. Because we might look at it, whoever wants to adopt the use of AI, we have to look at how are we going to integrate with the existing system of our pharmacy. So that if we don't do that, at the end of the day, we will not be able to sustain the use of that system. Of course, we need to consider again resistance to change. Nobody wants change. So as long as you are planning to adopt any of the AI solutions, you have to look at your staff. They have to be trained in line with that AI package that you want to use to accomplish a particular task. So it's important that we need to take that. Okay, regulatory hurdles, limited awareness and education, because we are here now. That's why we are having this kind of workshop, because we need to be aware. We need to have information about education and specialized knowledge, because AI is something that you have to acquire some knowledge before you can be able to actually operate it. So as pharmacists, or if you are engaging in any of these tasks, we need to ensure that we have a very good knowledge about it. Because of time, I will not be able, that's why I said the slide will be available. Telepharmacy on its own hand is a kind of service provision by pharmacy to patients irrespective of where they are. I discovered that we carry out a study of recent, I don't even know how we developed a topic on this. And we discovered that we've carried out a study among students, Faculty of Pharmacy, UIL, and Faculty of Pharmacy, OAU, as well as practicing community pharmacy and hospital pharmacy. We discovered that the awareness of AI is there, but it doesn't translate to the what? The usage of AI for their operations. So the result is very, very clear.
Well, a system. We'll be able to collect the data and say, oh, malaria is going up. Oh, diarrhea, there is, and people are coming to buy more of, anti-diarrhea and things like that, So, but it has to be deliberate. It has to come to the consciousness of the community pharmacists, for us to be able to use these things. Then another area of we need to pay attention to is how do community pharmacists get rewarded for collating this data and releasing the data. These are very key points. So we need to be deliberate on all these things. And, with this, working collaboratively, we can improve the pharmacy practice in the area of, medication therapy management and having desired outcomes in public health. So let me stop here so that if there are specific questions and this you can then address. Thank you so much.
Yes, sorry, sir. Thank you very much. In responding to your last statement, that's what will be the gain of community pharmacies by doing that data? I used to tell my students in class, research does not limit it to people in academia alone. Hospital practice, they sit on data. Community pharmacy sit on data. The only thing is that you can collaborate with academia to put its own scale so that you can actually put that data that you have into a proper thing and you can if you continue doing that, do you know that if your name continues to surface on different journals and all sorts, you can be contacted by all those WHO and all sorts. But you are doing good and they are seeing you. But that's the whole essence of feasibility. So, and that's part of indirectly, that's what gives you another thing. So you don't look at it that's first of all intentional collaboration. Let's come together. Let's bring our skills together. You will see the eventual thing. So that's the way it is. Thank you.
Okay. Thank you, Prof. You see that we are contending with almost an empty hall now. So I think we have to be business-like. Let me throw the floor open for questions at this juncture. If there are questions, or opinions, Chairman of the occasion, you will come last. My PS, yes? You'll be number 1. Charles will be 2. Is there any other person Okay, let's have you.
Thank you so much. My name is Pharmacist Biel Akinwande. It's not a question per se, but just a rider to what the Prof just said. When the National Secretary was asking that how will community pharmacy be rewarded, that's why I jotted down this procedure. That we shouldn't be thinking of reward first. The reward will come. That's what the thing. Let's assume that you have a proper kept data. And maybe in future, an organization is looking for a certain thing. And people know that you have that data and you are contacted. You'll be surprised. So don't let us put that reward thing first. Let's get the thing done first and properly documented. And if you do that one, I'm sure with time, that reward will come. That's just my added value. Thank you.
Charles. See a question, an opinion.
The chairman and the hall, please, I want to bring to our attention what is currently going on with ACPN at the national level. The current ESCO, led by Eze, instituted a research group which we have undergone trainings led by Professor Ubaka. Dr. Abdumiminu Isa is part of that team. We've gotten to the point where we've been put into groups. I'm in group 3, for instance. And very shortly, this group 3 covers Southwest. Southwest. I have to come out because the research questionnaire will be out shortly. We want to encourage us to partake. And the topic is hypertension self-care management practices and patient adherence educational research, enhancing community pharmacists' role. All protocols involved have been taken care of, including the consent for patients and approval for research. So I'm saying this now so that we can begin to start from there. So much has been said in the past concerning this research put together. ACPN is putting them together now in reality. So let's support it so that in the end, maybe at the conference in Kano, the research reports and results will be presented. Thank you.
Charles should be a professor of industrial pharmacy if we were promoting all the tenets of collaboration.
Thank you, the facilitator. Mine is on the patient-centered care. We need to be intentionally strategic in what we do. I like your presentation, but it should not sit only in usage. There should be a way that this thing can be stepped down or scaling down to other hospitals, even within the state. If there is a way that they are happening in Oyo State, we'll rather organize something like intra-professional collaboration among themselves now. The teaching hospital in the state hospitals, the special hospitals, so that there is peer review mechanism, so that these things can flow down. If it flows down, it becomes formidable in the state. It's not only in one institution. It's something that is being done holistically around the whole state. It carries more weight and will be able to generate more influence. And the future will definitely be bright. That's my comment.
Okay. It's a good thing. Mr. Chairman, sir, I think one of the things, one of the take-homes here today, and I think it's good you have the National Secretary here. And this is my own recommendation to PSN Oyo State. We should come out. Oladigbolu is also a member of NEC. So these things can echo very fast at National Secretariat. I think you should advise the PSN at national level to have an advocacy committee. We are long overdue for a formal advocacy committee. And then we can streamline our activities so that the advocacies will be probably within the realm or stratification of our various technical and interest groups. such that the type of presentation Pharmacist Adekoya had can be, and of course I know there are a dozen of such very progressive presentations all over. Bring them together, and through synergistic effects, it can become a lot more impactful. Ditto what Prof came up with. I didn't really listen to Gafar, but I have no doubt they will produce something very good. Gafar was a professor right from prelim when he was dubbed calculus in his university days. Brilliant, brilliant boy. And you know, it's the same story with an average pharmacist. It is time to showcase the academic excellence and wealth of knowledge. And this can best be demonstrated through the wealth of knowledge that we have always domiciled in our workplace. It can no longer be about workplace experience. Nigeria is a society where if you do not make noise, quote and unquote, nobody gives you a chance. So we need to do these things. And I hope the chairman is listening. The immediate past chairman, I can see you are following with rapt attention. And I think Oyo State, if it comes from Oyo State, widely regarded as one of the A states in the annals of PSN, then I think it can ignite some fire. And I believe these things are doable, and we must make them happen from 2025 moving forward. On that note, because I see it's gradually becoming an empty hall, I don't know whether we should just give our panelists 1 minute to wrap up. Postscripts, final thoughts, final comments. So let me start with you.
Okay. Thank you very much. The future I see for pharmacy, especially for community pharmacy, this collaboration, that a community pharmacist practicing in his pharmacy, with use of the data that he gets every day and publication in collaboration with academia, can become a professor. Yes. Can become, because professorship is given based on publications. So you can be in your pharmacy practice after you see part of it. You can be like we have been saying. We have been hearing that there are shortage of teachers in the universities. So these are there are some community pharmacies that if they are well orientated, they are more or less academic, but they just don't want to sit in the academic environment. You understand? So, but if there is this collaboration with their community practice, they can also be teaching in the university, and be carrying out research, and they'll be contributing to pharmacy development, so I'm bridging gaps. So I look forward to that, through collaboration and implementation of AI and the rest like that. Thank you.
Thank you, sir. Thank you for your contribution, sir. I just want to say that during our last AGM that happened in Oyo State, we had something similar to what you mentioned. We had a session where people in primary health care came to give presentation on the pharmaceutical care interventions that they've been having in their own practice, and then those in the secondary health institution and also federal. So we're able to rub minds and then give our insights as to how they can improve it. But going forward, what I would like to see is a situation whereby, as pharmacists, when we publish our data, we don't just publish our dispensing data and financial data. I want to see a situation whereby I can say that in Oyo State, we dispensed a total of 100,000 prescriptions, for example, and then 20% of those prescriptions required pharmacist intervention, and those interventions led to saving cost of so amounts and saved so lives and prevented so amounts of things. These are things that if we have them documented, if we go to the government with this clear-cut, evidence-based interventions, there is nothing that we would request for that will not be granted. And I hope that we can, with collaboration, be able to achieve some of these things. Thank you.
Okay. Yeah, thank you. For my own end of AI and telepharmacy, based on what we have rolled out as benefits and concerns in terms of safety, data security, and privacy. It's important for us to make sure that we are open to the possibility that AIs and telepharmacy will offer us, irrespective of our practice location. At the same time, we need to actually look at each of these benefits and the concerns and be able to see which one can we actually adopt and embrace in practice. I know most of us have been doing some of them, but we need to align it with some of the evolving role of pharmacy as we are moving to the future of pharmacy practice. So we need to be open to that possibility, look at which of those emerging technology that we can embrace or adopt in our particular pharmacy or where we are practicing, and we can actually harness the full potential while considering the challenges and barriers alongside such opportunities. Thank you very much.
So, let me therefore, distinguished colleagues, on behalf of these highly resourceful panelists and myself, we want to thank you for the invites extended to us. And we believe that the panelists in particular have offered good value. So, in closing, I want to say that the only time all of this becomes meaningful is when we begin to put into use the depth of knowledge that we're exposed to when we attend programs like this. In the new age, the new order, where we find ourselves, what makes you a professional largely remains the volume of revelation you communicate. I always say that, and I believe that they have done justice to the subject matter at hand, and I surely look forward to many more of us conveying information, albeit very confidently, and it shall certainly be well with our professionals as we do this. Thank you very much, and God bless you all.
Thank you. Please, this panelist and the moderator deserves another wonderful round of applause. It's been educative and also eye-opening session, and we believe that we will take all these information back home and make use of them in our respective corners, because I know we have different technical groups in PSN. So now at this moment, quickly, I would like to invite Pharm Adeyemi from NAFDAC Zonal Office briefly for their goodwill message. Please, Pharmacist Adeyemi, please come to the podium for your brief goodwill message. While Ogun State PSN chairman should get ready.
Good afternoon, ladies and gentlemen. All protocols duly observed. It gives me a great delight to be here representing the Director, NAFDAC Southwest Zone, and the Coordinating Director of the Zonal Formations of NAFDAC, in person of Mrs. Roslyn Ajay, will be present at this 2025 Oyo State Scientific Conference and launching of our Pharmacy House Secretariat Complex, with the team building a sustainable future for pharmacy. The Holy Book says it takes a man to do a man's job. So it will take the pharmacist to build a sustainable future for the noble profession, pharmacy. Some noble forerunners in the profession have labored. AJ Professor Emeritus Olaniyi, Baba Mole, Baba Motosho, and co. And some are still laboring. AJ Professor Mrs. T.C. Babalola, Professor Tele and co. building a solid foundation for the profession. However, it will take the wisdom of the forefathers, the forerunners, coupled with the innovative intelligence of the younger generations to harmoniously build a solid and sustainable, lasting profession. As an agency, NAFDAC considers PSN and affiliated associations as key stakeholders in our fight against the menace of drug abuse, as well as substandard and falsified pharmaceuticals. The DG NAFDAC and management, under the leadership of Professor Mrs. C.M. Adekoya, has zero tolerance for substandard and falsified medicines. The agency therefore solicits more support and collaboration of members of this noble and foremost society in order to stamp out drug abuse and substandard and falsified medicines, and in togetherness achieve the third goal of the Sustainable Development Goals, good health and well-being, which is health coverage for all by year 2030. On behalf of the Director, Southwest Zone, I wish all members of this great society a great and fulfilling 2025 Scientific Week and launching of the Pharmacy House. Thank you and God bless.
Thank you very much, NAFDAC, the watchdog of medicine and other items that we consume in Nigeria. Thank you for all you do. Now I want to invite to the podium the chairman, PSN Oyo State Chapter, for our goodwill message. Please, a round of applause for her. They travel all the way from Oyo State to be here with us.
Thank you very much. Good afternoon, everyone. The National President of the Pharmaceutical Society of Nigeria, ably represented by Pharmacist Madei, our past President of PSN, here present, I welcome every one of you. The Oyo State PSN Chairman, you are welcome. The past Chairman of Oyo State, here seated, you are welcome. All our senior colleagues, the men of giants of PSN, fellows, you are all welcome to this occasion. Our esteemed colleagues, honorable pharmacists, ladies and gentlemen, you are welcome. I'm here this evening to bring you good news and messages from Oyo State. We are very happy that we are here this afternoon. We were invited and we came. Last month we invited you and you came to Abeokuta. You really surprised us and we appreciate you for what you have done. And we have come here today because the theme, since building a sustainable future for pharmacy practice, is apt. I will know that great things shall come from this conference. And we know, I'm congratulating you because we had a great conference here today. And I was seeking for, we have come, let us have collaboration between the two states. Let us have what to do. And I believe that the soft copy of the presentations today shall be made available. And they said, like what we said, learning is an age-long process. It's something that is ongoing. I have learned a lot today, and everything that I've learned, it shall be taken down to Oyo State. And I'm here with my secretary, Pharmacist Akintayo. And once again, I want to say congratulations. I appreciate all of you. I appreciate all of you. I'm also appreciating Professor Babalola. Thank you very much. I had a great time. Though we saw last in the saying when we came for the with the Reverend, but we thank God for everything. Once again, I want to say thank you. I know that the pharmacy profession shall move forward with collaboration from all the tiers of a pharmacy pharmacy profession and pharmacists, we shall move higher and we shall get to that destination point that we desired. Thank you very much. Once again, Oyo State PSN, congratulations.
Yeah. It's good to rub backs. Oyo PSN rubbed the back of Ogun PSN, and they are now here to retaliate. Please retaliate to them by another round of applause. When next you invite us, we also retaliate. Retaliation will follow retaliations. Thank you very much, ladies and gentlemen. We really appreciate you for your patience so far. And we are moving towards the end of this event. But it's very important to also honor and recognize some important personalities, especially the panelists and some of the keynote presenters here today. So I will call Pharmacist Anthony Bola Oyawole to come forward for the presentation of the awards.
I have the privilege of inviting the keynote address speaker to please step forward. I believe we all agree that we had a good speech today, a workable speech. A speech that we are definitely going to divide into many parts so that it can be studied well, action points developed, and worked on. Because this one particular scientific conference will not be just a talk shop. It's going to be an action-backed activity. And I believe with the caliber of our chairman of Oyo State, this is going to be the result of what is going to come out of this scientific conference. So, on behalf of the PSN Oyo State Branch, I have the honor and privilege, with the greatest gratitude of the state, presenting this appreciation plaque of outstanding delivery of the keynote address at this year 2025 Scientific Conference of the Pharmaceutical Society of Nigeria, Oyo State Branch, to our own dear pharmacist, Professor Chinedum Peace Babalola. Congratulations. Professor Adisa, can you please step forward? Our dear Professor Rasaq Adisa, this is an award of appreciation from PSN Oyo State Branch with their deepest gratitude for a well-researched, delivered, thought-provoking panelist lecture which has aroused our interest and is gearing us up for the future of pharmacy practice, which we believe is going to be sustainable in our own lifetime and pass on to those coming behind. So I have the privilege of presenting to you this appreciation plaque for the good rendition you brought to bear in making this 2025 Scientific Conference a remarkable one. Congratulations, sir.
The next award is going to Pharmacist Dr. Omobolanle Adekoya. Please come forward.
Our dear Pharmacist Dr. Omobolanle Adekoya, with your patient-centered care presentation today, which we believe is a top-notch, and by popular demand has even been signposted by one of the living ancestors that it should be one of the working documents that should be passed over to the National PSN for policy and advocacy document that could be prepared from it, so that Nigerians can know that pharmacists are up to par and they are doing wonderfully well in all areas of practice, and they are impacting the health sector positively in Nigeria and saving life and saving medications worth billions, so that the health of Nigerians will be better for it. On this occasion, with the deepest gratitude from PSN Oyo State Branch, we present to you this appreciation award for your outstanding contribution as a panelist at this year 2025 Scientific Congress. Congratulations.
Pharmacist Akala, please. Your attention is needed. Pharmacist Akala. All right. I also have the honor to welcome to the podium Pharmacist Anthony B. Oyawole, FPSN, the chairman of this conference. I'll call. Okay. You're welcome, sir. All right. Pharmacist Ogunye is presenting this award to the chairman of this year's conference.
In appreciation of your patience, your attendance, and your collaboration with Oyo State PSN, the society is pleased and happy to present this plaque to Pharmacist Anthony B. Oyawole, FPSN, in appreciation of your brilliant performance as chairman at the 2025 Scientific Conference of the Pharmaceutical Society of Nigeria, Oyo State Branch, in this hall, MOV 21 Event Center, Ring Road, Ibadan, held today, 9th July 2025. You are highly appreciated. Thank you very much for attending.
Congratulations, sir. And now I will call on the moderator of today's panel session, Pharm, Olumide, Akintayo, FPSN, for his award, and it's to be presented by Pharmacist Raphael Ikwola Ogunye. Okay, all right. Apologies.
I have the singular. honored to invite Daddy Fachesin, a fellow of the society, to come and do the presentation.
Thank you very much. I think this is a very privileged honor for me to present this plaque of honor to my life president of the Pharmaceutical Society of Nigeria. I call him my presido any day. Yeah. This is a plaque of recognition and appreciation from the PSN Oyo State Branch, presented to you, Pharmacist Olumide Akintayo, fellow Pharmaceutical Society of Nigeria, in appreciation of your outstanding performance as lead facilitator at the 2025 Scientific Conference at MOVE 21 Event Center, Ring Road, Ibadan, held today, 19th July 2025. Thank you very much, my president.
Thank you.
Very much.
Congratulations.
Next on our agenda is the photo sessions and special announcements. Let's all listen to the special announcements. Special announcement is for all pharmacists in Oyo State. The program still continues tomorrow with a town hall meeting by 9 a.m. to 12 p.m. We encourage every pharmacist in Oyo State to be here present so that we can rub minds together for the town hall meeting. The next is the closing remark and the vote of thanks from the General Secretary, Pharmacist Adekoya Akala.
Good afternoon, everybody. Good afternoon, everybody. The chairman, PSN Oyo State, fellows of the Pharmaceutical Society of Nigeria, elders of the professions in the state, and our guests, colleagues, friends, and gentlemen of the press. I feel honored to be called upon to come and say a thank you for finding time to attend this, our scientific conference. It is indeed a mark of honor, and we are not taking it for granted, because you have 1,001 things you have spent your time on. And for you to have decided to stay with us even to the end of the program, it's a wonderful honor. So we are saying a very big thank you. And I want to believe you've enjoyed yourself. You have nice time with us. And I will enjoy my colleagues. As they depart, they should not drop all we've learned today. Pharmacy is going to a state of advocacy, and we must not forget the center of healthcare, our patients. And on this, I will enjoin us to keep reminding what we are being taught by the guest speaker. Our week is still ongoing. Tomorrow is the launching of our pharmacy house. PSN Oyo State is proud to tell you that we are having a pharmacy house second to none in the history of PSN in Nigeria. And I want to invite everybody for this launching tomorrow. It is happening right in this hall by 12 noon. All are invited. Thank you once again for coming, and for all our sponsors that have made today a wonderful success, the pharmaceutical companies that have come in various ways to give us credible support. We are saying a big thank you. Thank you, and God bless.
Thank you, ladies and gentlemen. It's a wrap for today's event, and tomorrow, it has been announced, 9 a.m. tomorrow is a town hall meeting, and I want to sincerely appreciate you all on behalf of my colleague that we've been anchoring this event together, Pharmacists, Marzuk, Ahmed. Thank you all as we take the profession to the next level, one prescription at a time. Once again, I am your host, Olumide Adekoya. See you tomorrow. God bless.
Pharmacists in Oyo State, and this is our week.